So the owner of this car, please, you are asked to come and repark. Registration number SMK589DB. I am not sure the type of vehicle, but if that's your vehicle, please, your attention is needed outside. SMK589DB. Thank you. Invited guests, ladies and gentlemen, principal officers of the University and the College of Medicine, I crave our indulgence all to take our positions in our seats, and let us rise as we take the first stanza of the Nigerian National Anthem. Shall we rise for the Nigerian National Anthem? So the College of Medicine, University of Ibadan Anthem. Thank you very much. May we, please, while we remain standing, take the second stanza of the Nigerian National Anthem as our opening prayer. O God of creation, O God of creation, guide our noble cause, guide our leaders right, help our youths the truth to know, in love and honesty to grow. Lead us to a true heights attain, to build a nation where justice and justice shall reign. Amen. Thank you very much. You may please be seated. So was it deliberate that we had to go through the anthems? You know, we are all used to watching the Senate and asking our politicians to read the anthem. So I had to make you go through that route so that you learn all the anthems. Thank you very much. Ladies and gentlemen, eminent personalities here in our midst this morning, may I wonderfully welcome you to this occasion. And we promise to keep it short and simple so that we can be here out of here in no time. May I also appeal to our very many media men, photographers and videographers, please find comfortable spots behind the guests so that you are not blocking people as you capture these wonderful moments. Once again, I want to welcome all of us, and I want you to give a round of applause for yourself for making it to this occasion. Indeed, outside the celebrant, you are the most important person that we have in this hall today. Of course, it's understandable that the celebrant is the most important because it's because of him that we are all gathered here. So, ladies and gentlemen, I have a very long list, I think about 5 pages of people to recognize. So I'm not going to do it. I'm going to crave the indulgence of the principal officers of the university and the college here, and I will just introduce the high table to us and intermittently mention a few names amongst those of us that are not on the high table. So please forgive me in advance if I do not get to mention your name along the line. It is because of our time, and it is also because, indeed, if you are not as important, you will not be seated in this hall as we speak right now. And that's why, once again, I want you to put your hands together for yourself for making it here this morning. A round of applause for you. So, ladies and gentlemen, welcome with me to this wonderful program. The man who is at the helm of affairs of this institution is the #1 man of this institution. Yes. Thank you. Yes, just as I suspect, many more names will join. I've taken permission. I will be like the beavers. I will upload some results and I will skip some results. So that you can take me to court and you hear the judgment. It's not in the Constitution. So if you don't hear your name, they gave me your name. Just that the beavers didn't upload it. Welcome with me, the #1 man in this institution, and that is the Vice Chancellor of the first and the best, the premier university, Professor K.O. Adebowale, FAS, ably represented this morning by the Deputy Vice Chancellor of Academics, Professor Ayotunde Ajaiyeoba. A round of applause for her. A round of applause for her. And of course, welcome with me the woman who is working even harder than the men that have gone before her. The first female provost of the College of Medicine, energetic, elegant, beautiful yet full of brains. The provost of the College of Medicine, University of Ibadan, Professor anybody, a round of applause for her. You are welcome, ma'am. I hope Prof is not in the crowd for calling his wife beautiful now. I hope I'm safe. Ladies and gentlemen, welcome with me the Secretary to the College of Medicine, man who has been working tirelessly to make sure everything gets sorted. Mr. A.E. Odedele, a round of applause for him. You are welcome, sir. The CMD, well, I don't think he's around yet. The co-host, the Chief Medical Director, and is to be represented by the CMAC. When he comes, I will recognize him as appropriate. Welcome with me this morning also, the head of the department that is, I'm not sure he has slept. I ran past him yesterday. He was still putting up banners and all of that. Welcome with me, the head of the Department of Ophthalmology, College of Medicine, University of Ibadan, University College Hospital. Dr. Olula, a round of applause for him. A round of applause for him. Is it a coincidence that they put a very fine, handsome, maybe, I'll be more appropriately head of department for this occasion? Because the celebrant takes particular attention to how you look. And I'm sure I'll still get, sir, I have to polish my shoe again this morning. And I have to go and look for the perfume that is the most expensive one. Because I remember you can't be doing special posting with Prof. Ajaiyeoba and not wear a good perfume. There will be trouble. Ladies and gentlemen, welcome with me the chairman of today's occasion. She's a teacher of teachers. If I may be teacher of grand teachers now. And retired many years ago, but still stronger than those that are serving. Welcome with me, Mama Oyola Olu. A round of applause for her. A round of applause for her. Some of the ladies buy colors of attachments to get the gray or silver hair. I don't know the color now, but I know they start from color 1, 2, 3, 4, 5 and co. And I tell them, don't bother buying color, wait for your time. And you can see my nose end the gray hair. So those of you buying my hair, you can see as we can commercialize we take a few strands to reproduce. I'll be your manager now. There's money there. A round of applause once again for the chairperson. Ladies and gentlemen, welcome with me to the high table, the Chief Medical Director of the University College Hospital Ibadan, ably represented by the Chairman Medical Advisory Committee, Dr. Abiodun Adeyeye. A round of applause for him. A round of applause for him. That's the seat. That's the seat there. Thank you. Of course, he didn't come alone. He came with the Director of Administration and Secretary to the Board of the University College Hospital, Mr. Stephen Ilibu Sayoladejo. A round of applause for him. You are welcome, sir. Okay, so last but not the least, in fact, I think it's the reason why not that I think, it is the reason why we are here this morning. Welcome with me the celebrant of today. I've told you about being a fine gentleman. I don't know how many teenagers that will still resist his toasting skills at this age. He's got the physique and the look, and I'm sure he has the pocket. The subsidy is still in the pocket. Welcome with me a young man who we are celebrating today, Professor Ajaiyeoba. A round of applause for him. He's a true son of the soil. Don't worry, you get the citation, you get the pages. Ladies and gentlemen, permit me to recognize in our midst this morning eminent personalities, past provosts of the College of Medicine here present. Actually, Professor Kinyinka is here, Professor Olugbadun, Professor. Okay, sorry. Shall all the past provosts of the College of Medicine, a round of applause. Shall you please rise to your feet? Rise up for recognition, sirs. Past provosts of the college. A round of applause for them. And of course, I have past CMDs here. Professor Leson is always represented. A round of applause for Prof, sir. You are welcome, sir. We have deans of faculties here present, and I'm going to take the indulgence of the VC now to not mention one by one, and the provost. A round of applause for all deans of faculties here present. A round of applause for them. Heads of department here present. A round of applause for them. And of course, I know the ophthalmology nurses are here. Yes, a round of applause for all the nurses in the house this morning. A round of applause for them. Permit me to then single out the wife of the celebrant for today, Professor Edith, and the children, Dr. Dami, Dr. Ayo, Engineer Ope, and Ms. Tinu in absentia. Shall we all rise to your feet? A round of applause for them. And of course, I know he had to identify as a member of the family. Just that I didn't mention his name, because he's truly a member of the family. Welcome with me, Professor Ayotunde Ajaiyeoba. A round of applause for him. You're welcome, sir. Yes. I'm going to stop there for now. I know, again, the celebrant gave me a long list of names of his friends that are here. I will come back to call some of the names later. But please, so that I don't bore you, I always warn people when I want to start. By profession, I'm an anesthetist. My job is to put people to sleep. So if you allow me to talk for too much as a stretch, you might find yourself sleeping. But it won't be strange. People slept in court 2 days ago. So we know that sleeping is permitted now. Ladies and gentlemen, permit me to call on the head of the Department of Ophthalmology, Professor T.S. Oluleye, as he welcomes us to this occasion. A round of applause for him.
Thank you. At last, the chairperson of today, Professor Oyadeolori, OFR, our grand man in ophthalmology. Thank you. The Vice Chancellor, ably represented by our second grand man in ophthalmology, Professor Aderonke Dawoju. Our indefatigable provost, College of Medicine, Professor Olayinka Omigbodo. The Chief Medical Director, University College Hospital, ably represented by our Dr. Abiodun Adeoye, our CMAC. All past Vice Chancellors present, all past CMDs, all past provosts, the principal officers of the college, the secretary to the college, on the high table, all deans present and all directors of institutes, all head of departments, all elders and teachers of our profession, we salute you all for coming. All academic staff, consultants, resident doctors, I can see you, nursing staff, our royal highnesses, Lord spiritual and temporal, members of the press, medical students, student nurses, all other categories of students and staff. Ladies and gentlemen, you are welcome to this occasion. This is the day the Lord has made, and we are rejoicing and we are glad in it. Today is another historic moment in our institution. Our father in ophthalmology, Professor Ayotunde Ajaiyeoba, is retiring from active service at the ripe age of 70 years. Let's give a round of applause for that. I remember my very first day in ophthalmology as a resident. I saw a confident ophthalmologist in Professor Ajaiyeoba with his snow white work coat blazing red tie, and Gucci shoes. And he was giving a lecture to the medical students. And I can vividly remember telling them, if you come to my ward round with this cheap tie, I'm going to send you out of that ward round. Please don't go to Sabo to buy those cheap perfumes. If I notice that in you, you will not enter my ward round. I made up my mind there and then I want to be like him. It's about 30 years now, and I'm here to catch up with him. Please, let's give him a big round of applause. Today is a momentous day for all of us gathered here as we come together to celebrate and pay tribute to a distinguished figure, Professor Ayotunde Ajaiyeoba. On behalf of the Department of Ophthalmology, it is my distinct honor and privilege to extend to you all the warmest and welcomes this remarkable valedictory program. Your presence here today reflects the deep respect and admiration we hold for Professor Ajaiyeoba. We are deeply grateful for your participation in honoring a man who has made an enduring impact in our lives and in the field of ophthalmology. Your presence here today shows this, and we are very grateful. He is a true giant in the field of ophthalmology. He has dedicated his life to the advancement of eye care, and his contributions have had a profound impact on the lives of countless patients. He is a brilliant clinician, a gifted educator, and a tireless advocate to the underserved. Indeed, his journey through life is nothing short of extraordinary. His leadership, including his tenure as the head of the Department of Ophthalmology and the Dean of the Faculty of Clinical Sciences, has been instrumental to our departmental growth and development. We have flourished under his guidance, and his legacy will continue to inspire us. Today, we celebrate Professor Ajaiyeoba's retirement and birthday with great joy and gratitude. We wish him a long and happy retirement, filled with good health and the knowledge that he leaves behind a department and a profession forever transformed by his contributions. Retirement is a long vacation. It's not an end. It's a new beginning. Retirement is when you finally do all the things you said you would do when you retire. Retirement is when you forget what day of the week it is. It doesn't matter anyway. When you can finally take that long nap you've been dreaming of. Congratulations, sir, on your retirement. Thank you, sir, for the opportunity to work with you. You have always been an amazing mentor and role model to us in ophthalmology. We truly appreciate your dedication to the team and your commitment to the success in ophthalmology. Your leadership and guidance have been invaluable. You have been such as an inspiration, and we are so grateful for all the guidance and support you have provided. Working with you has been a great learning experience, and we are so appreciative of all the knowledge you have shared with us. We are thankful for your thoughtful advice, constructive feedback, and encouragement. We cannot repay you the sacrifice you have given us. All we can do is pray for you and your family. May the Lord keep you and be gracious unto you. He will make his face to shine on you and grant you peace in retirement. Amen. To do justice to the lecture of today is an erudite scholar, Professor Omoti, the current chairman of the National Eye Health Committee, Federal Ministry of Health, Abuja. The two of them go way back, and I'm sure we will all enjoy the lecture. On behalf of the Ophthalmology Department, I thank you for joining us in celebrating this special occasion. God bless you all.
A round of applause for. So I have removed the sabo tie. They've given me the correct one. Ladies and gentlemen, we've had just a snippet of his contribution to his department, and I'm sure by the time we are through today, we will know how much of a giant our celebrant of today is. Permit me then, ladies and gentlemen, to hand over the microphone to the chairperson of today, I've said she's the teacher of our grand teachers. And I'm sure, just like your teacher knows everything, you can package for your students, you can't package for your teacher. She'll probably have enough stories about the celebrant of today. With a big round of applause, welcome with me to the microphone for the chairman's opening remarks, Professor Oyade Oluri. A round of applause for her.
Thank you very much. And good morning to you all. It is difficult for people of my age to remember all these protocols. So you'll forgive me if I say all protocols observed. When I walk along the corridors of usage uninvited, and people recognize me, I say to myself, that one will soon retire. Because I retired in 1986. For anybody to recognize somebody who retired in 1986, they themselves must be getting on. The young man we are honoring today was not quite 6 years old when I first got my MB in 1959. He was almost 6 years old. So you can say that I am really talking about my son. It's been a long journey, and I will let out one or two things about this. Dr. Ajaiyeoba wanted to do general surgery. He changed his mind. The general surgeons, including my late husband, Professor E.O. Olure, and Professor Ajayi, would not let go. So we had a toss. I was on one side with Professor Osuntokun, and they were on the other side. Naturally, we won. And I'm glad we won, because Dr. Ajaiyeoba has been a blessing to ophthalmology and to this university. I'm not supposed to read his citation, but when he was being examined for the part 1 of ophthalmology, we had external examiners. And one of them was from Northern Ireland, Belfast. And after examining Dr. Ajaiyeoba, he said to us, we would like to have him for his 1 year abroad. We didn't have to apply. He didn't have to apply. This professor said they wanted him. Now you can imagine how we all felt. But he was going to Belfast. At that time, there was civil war in Belfast. Having agreed to let him go, I was beginning to have doubts about our acceptance of this offer. So I took a trip during my sabbatical to Belfast to see not only that he was alive, but also that he was not in any danger. So you see, this is my son. Of course, I don't have to say that I was present at his wedding, many, many, many miles away. But I enjoyed it. It was a pleasure. And I'm glad that it took place, and I'm glad of what we have produced from that wedding. When Dr. Ajaiyeoba came to me and said he wanted me to be at this lecture, I could not refuse, because this is my son. And if your son is being celebrated, the least you can do is to make yourself available, especially if this is a son that you can be proud of, known not only in ophthalmology in Nigeria, but also all over the world for what he has done, the research and the papers, and the impact he has had on younger ophthalmologists. Let me sing the song. Teacher olùkọ́ ayé, teacher olùkọ́ ayé, tó bá kọ́ mi máa kọ́mọ rẹ. My daughter was a student to Professor Ajaiyeoba. She was bent on doing neurosurgery, scam the man. That's what she was bent on doing. I don't know who had the influence on her, certainly not me. And she came and she said she was going to do ophthalmology. My husband and I looked at each other and said, could this be so? Is she giving up cracking people's skulls to opening people's eyes? But that's how. And she had good tutorship in the Department of Ophthalmology from the seniors in that department, including Professor Ajaiyeoba. So you see, I am ophthalmology. Ophthalmology is Olure, as long as I remain alive. Thank you very much for your indulgence in listening to this opening remark.
A big round of applause for her. I don't know how many of us whose mom, academic now, can stand and say, this is my son 5 times in a 5-minute speech. He is my son. He is my son. So I hope my teachers can say I'm their son now. I must be quite unruly. I don't know. I'll change my ways so that somebody will say it's my son. Ladies and gentlemen, permit me to just mention a few people once again. A round of applause for Barrister Ogunyomi is in our midst this morning. Mr. Mokemi, a round of applause. Ambassador and Ambassador, Labiron, a round of applause. I have Pastor, Dr. and Pastor Mrs. Olado, a round of applause for them. Okay, the papers are falling, so I'll stop again. Ladies and gentlemen, we are here to listen to something about ophthalmology. Without the eyes, the whole body cannot function. And that is why, the Bible talks about young men seeing vision, because he knew that they will need the eyes to see. And he talked about old men dreaming dreams. You may close your eyes when you are old, but as a young man, you need to see. So I'm sure there's something that we are going to hear this morning about eye health that will ginger the young ones to see better, and even those that are going to be dreaming. Ladies and gentlemen, welcome with me to read the citation of our valedictory lecturer this morning, Dr. T.F. Sarimiye. A round of applause for him.
Good morning, sirs and ma'ams. It's an honor standing in front of you to read the citation of the lecturer for today. I want to crave your indulgence to stand on the existing protocol that was established by the chairman of the occasion. Yeah. The lecturer for today, sir, can you write? The lecturer for today is Professor Afikedi N.S. Omoti. He was born some 55 years ago in Igara, Edo State, and he also hails from Umeme, Erunro, Akoko Edo local government area, also in Edo State. He had his secondary education at the Federal Government College, Warri, between 1985 and 1991, and went ahead to study medicine at the University of Benin, aka Unibest, and had his fellowship in both colleges, West African College of Surgeon and also the National Postgraduate Medical College in 1999. During his residency, he got a distinction in pharmacology. Thank you. During this time of his residency also, he won the Oyin Olori Prize for the best candidate in Part 1 fellowship examination of the Faculty of Ophthalmology. He also won the Akinsese Prize for the best candidate in the Part 2 final exams, and he also won the overall best graduating candidate of the Faculty of Ophthalmology, National Postgraduate Medical College in 1999. He joined the faculty of the University of Benin in 2002 and was promoted to the grade of professor in 2010. He obtained his MD from the National Postgraduate Medical College in the year 2020, and he had numerous certifications and degrees that are too lengthy for me to list. He is a member of numerous associations, both nationally and internationally, including the Nigerian Surgical Research Society, the Institute of Policy Management Development, the Glaucoma Society of Nigeria, the Glaucoma Association, the World Glaucoma Association, the Oxford Ophthalmology Congress, the African Ophthalmology Council, just to mention a few. He has served at different times as examiner at the National Postgraduate Medical College of Nigeria, Faculty of Ophthalmology, external examiner to the Appointment and Promotion Board of the Ambrose Ali University College of Medicine, and also College of Medical Sciences, College of Medicine, Ekpoma. He also served as member of the accreditation team of the Faculty of Ophthalmology, National Postgraduate Medical College accreditation team to the to the University of Medical Sciences, Ondo State. Also a member of the accreditation team of the Faculty of Ophthalmology, National Postgraduate Medical College of Nigeria to the Obafemi Awolowo University. He has served as head of department of the Department of Ophthalmology, University of Benin. He is a past chairperson of the Nigerian Medical Association, Edo State Chapter. He is currently the chairman, National Eye Health Committee of the Federal Ministry of Health, Federal Republic of Nigeria. And this position he has held from 2021 till date. He has successfully supervised dissertations and mentored well over 60 resident doctors who are now consultant ophthalmologists and some of them professors already. He is an avid researcher with over 130 published articles both in local and international journals, with his major area of interest being glaucoma and anterior segment disorders. He is passionate about the underprivileged and has been involved in several philanthropic activities, including building a house to accommodate internally displaced children from the northeast of Nigeria. He has also sponsored, organized, and volunteered in several free medical and surgical outreaches. His hobbies include football, reading, writing, and watching movies. Distinguished ladies and gentlemen, let's welcome the lecturer for this august occasion, a man of many parts, an erudite scholar, and a mentor to many, including myself, Professor Afikede N.S. Omoti. You're welcome, sir.
A castle now, be? Okay, no, it's exactly in between. So a caro and a castle, whichever one works out. Pardon me. I won't say good morning or good afternoon today. The chairman of the occasion, Professor Oyin Lorin, a doyen of ophthalmology in Nigeria. It's my personal privilege to be standing in front of you today. And just as the previous person said, let me stand on the existing protocol ably established by you. Thank you very much. So the topic today is essentially the compendium of the activities we have had since we came on board in the National Eye Health Committee at the Federal Ministry of Health. And interestingly, the man we are celebrating today, Professor Ajaiyeoba, is part of it. And that's why this topic was chosen. I'll use the various outlines I've listed here. I had prepared for a 1.5 hour lecture, but I'm told that I have only 40 minutes. So I will be a bit fast in some areas. Well, I want to dedicate this lecture today to the Almighty God, who have been our help in ages past and our hope for years to come. And also to the Almighty God who has preserved the celebrant today, Professor Ayotunde Ajaiyeoba, till this date, in good health and state of mind, to bow out gracefully from active public service. May his name be forever praised. To the family of Professor Ajaiyeoba, both nuclear and extended, and to everyone who has given Professor Ayotunde Ajaiyeoba a helping hand, one way or the other. And of course, to the institutions where he has worked, the Premier University and the University College Hospital, Ibadan. We are here to honor a man who has class, as has been described already. A gentleman, a role model, a true icon in every sense of the word. A man we call a dear friend, a teacher of teachers, a professor of professors, an ophthalmologist par excellence, and a beacon of medical education. I heard somebody mention that we go way back. We don't really go way back. He was my teacher. And the first time I met him was when he was secretary of the Faculty of Ophthalmology of the National Postgraduate Medical College. So I'm by far his junior. I was a resident doctor then. And that was at the National College. Although every time I enter this room, he keeps giving me the creeps because this is where I wrote most of my theory exams. And then the hall looked much bigger then. So far to the front. But now suddenly looking so small. So I recently met a friend from UK who described sight as an opportunity to learn, to earn, for well-being and for safety. And throughout this lecture, we will find that he was probably right. Eye diseases and vision loss are global health problems that impose a significant socioeconomic burden on nations, families, and individuals. For the individual, blindness is a devastating event that often leads to poverty and a lifetime of despondency, dependency, higher risk of accidents, other chronic diseases and death, especially in developing countries where more than 90% of the blind reside. There is undeniable evidence that access to eye care throughout life contributes to the direct and indirect attainment of this the United Nations Sustainable Development Goals. Now, the various goals which I will list here include eradication of hunger, Goal 1, ensuring zero poverty, Goal 2, ensuring good health and well-being, Goal 3, ensuring good quality education, Goal 4, gender equality and reduced can receive health services they need without experiencing financial hardship is a WHO strategy, and that has been our goal. The number of people who are blind or visually impaired is increasing, even though there is a highly effective treatment for two of the major causes of blindness and visual impairment, cataracts and refractive error. They probably have in the entire medical profession the most cost-effective interventions of any disease entity in medicine. Now, if we look at this background, Ajaiyeoba AI in 1994 published his earlier works on childhood blindness, and one of his retrospective studies in the University College Hospital showed that the major causes of blindness included injury, measles, keratitis, malnutrition, optic atrophy, and cataract. He also, in the study with Fadering and Ajaiyeoba, he also showed the distribution of refractive error, showed that hypermetropia was by far the most common, over 50% of cases, with astigmatism being second and myopia last. And then one major study he did was a national survey in vitamin A deficiency, where he showed that xerophthalmia, which is a symptomatic vitamin A deficiency, was responsible for, had a prevalence of 1.1%, a national prevalence of 1.1%, and when a serum retinol level of less than 20 microgram per DL or 0.7 micromole per liter was used as cutoff, the prevalence was 28.1%. If we look here, we'll find that the Southeast practically had 0% prevalence of xerophthalmia, but Southwest, interestingly, was by far the highest. Over 50% was in the Southwest, most likely because of dietary conditions. And then, among school children, secondary school children, he found that the conjunctival diseases were one followed by refractive errors, lid disorders, corneal scarring, and cataract. And then, in a community-based study showing all age groups, it showed that 1.22% of the population were blind, and 1.43% additionally were unilaterally blind in only one eye, while an additional 2.09% had visual impairment. There was a progressive increase in the prevalence of blindness and visual impairment with age. And the most common causes of blindness were cataract, glaucoma, corneal opacity, and optic atrophy. And in another study done at the Ring Road State Hospital by Oluleye Ajaiyeoba et al., they also reported the prevalence of the highest cause of blindness to be cataract, glaucoma, optic atrophy, corneal opacity. Now, I will focus a little bit on the work we have done on child health, because that is one area that Professor Ajaiyeoba focused his earlier work. Although recently I've heard that he's been entering into the neuro-ophthalmology group, and I really was a bit confused about what he was doing there, so I was planning to ask him about that when I get here. And to prove it, the neuro-ophthalmology group actually sent their strong appreciation to him, and which we'll do later. I will be using the demographic studies of 2018 because that's what we used in the Ministry of Health recent guidelines. Now, the Nigerian Demographic and Health Survey of 2018 statistics show that children aged 0 to 17 years formed the bulk of the population of Nigeria, 52%. And about 48% of children younger than 19 years reside in urban areas, 54% in rural areas. Now, why was he probably interested in children and adolescents have significant needs for health promotion, prevention, and healthcare services? They have the longest number of years that they will be blind if they are not treated on time. Now, the under 5 mortality rate is a proxy indicator for childhood blindness, and studies shows that it has declined over the last, till 2018, 40 years, from 292.7 deaths per 1,000 live births in 1969 to 119.9 deaths per 1,000 births in 2018. And we found that a lot of the blindness was related to vitamin A deficiency and corneal blindness. Now, in those days, a lot of the blindness we refer to as tropical blindness were mostly a combination of vitamin A deficiency, measles, malnutrition, infection with herpes simplex, traditional eye medication, and some degree of dehydration in addition. And all that contributed to their cornea, loss of their corneal transparency and subsequent blindness. But but recently, with advances, especially with immunization, distribution of vitamin A, which has reduced these problems, we are now finding that the burden of non-communicable diseases, the burden of non-communicable diseases, like inherited cataracts, retinopathy of prematurity, retinoblastoma, and cerebral palsy, are beginning to increase as the major causes of ocular morbidity in children. Now, the National Eye Health Program is a policy-making organ of the federal government of Nigeria, and it is domiciled in the Department of Public Health and headed by an ophthalmologist known as the National Coordinator. It is directly under the Minister of State for Health, and the National Eye Center, Kaduna, is its implementing partner. In its organogram, it's just from the Honorable Minister down to the National Eye Health Program, but then a committee was set up to have governing oversight over its functions, known as the National Eye Health Committee, which has my humble self as the chairman, the medical director of the National Eye Center, Kaduna, as vice chairman, the national coordinator of eye health in Nigeria as the secretary, all the presidents of the 4 professional bodies in Nigeria that relate to eye health. That's the Ophthalmological Society of Nigeria, the National Optometric Association, the Association of Nigerian Dispensing Opticians, and the Nigerian Ophthalmic Nurses Association. Their presidents are all members, and then we have 6 zonal coordinators and our partners who support us financially. Our vision is to reduce the burden of blindness, a burden of avoidable blindness and visual impairment among the Nigerian population. The mission is to formulate policy, guidelines, and coordinate under the directives of the Honorable Minister of Health all eye activities and matters relating to the prevention of blindness and rehabilitation of blind in Nigeria. Our mandate is to coordinate the development of inclusive patient-centered eye health policies and guidelines, support the implementation and evaluation of eye health intervention in Nigeria through intersectoral and multi-sectoral collaboration. So what I'll be talking about now will be like our scorecard for you to judge whether we have at least started on this onerous mission. Now, in the past, we all know that Nigeria has a tendency of policy somersaults One government comes in, does one thing, and then another government comes in, discards everything and starts afresh. So what we have done is that for every policy we want to go through, we ensure that we have the widest stakeholder involvement to ensure that no matter who comes in next, the same policies will continue. And they are all published and approved by the National Council of States. We have been able to publish the Nigerian National Health Policy and several guidelines. The earlier guidelines were all related to childhood blindness. I will talk about them later. The first 4 publications before the Eye on COVID, which we did during the COVID era. On the same day, the National Health Policy is this National Health Policy was the first that has ever been done in Nigeria. And it was adopted at the 62nd National Council of Health by all states in Nigeria. And then on the 3rd of February 2022, which was the same day that the National Eye Health Committee was launched or inaugurated, on that same day, the National Eye Health Policy was launched. Well, on that day, okay, this picture is not focused well enough. You will have seen some people present here on that day. I think that's Dr. Bijike Ajayi present here. And well, let's just move on. Now, the absence of the National Eye Health Policy guidelines had hitherto made a coordinated approach to reducing avoidable blindness and its impact difficult at all levels. Now, the aim of this policy is to drive the national eye health agenda against the backdrop of regional and international perspectives for the elimination of avoidable blindness by achieving universal eye health, which is a component of universal health coverage that ensures that the eye covers a wide range of eye disorders, from promotion, prevention, curative, rehabilitative care in an equitable manner to every Nigerian, irrespective of age, gender, ethnicity, religion, and socioeconomic status, without being impoverished. We all know that today, the majority of Nigerians have to pay out of pocket for their health services, and that's one of the burdens or challenges we need to overcome in eye health. Now, the properties include equity, which I mentioned, equitable distribution of the eye health to everybody. It should be people-centered. The people who are receiving the eye health must participate in ensuring that they get the kind of eye health that they require. It must be culture appropriate. I will talk about that in more details. Evidence-based. We are using published scientific work to make our decisions. There will be intersectoral collaboration, which I will talk about in more details later, and then partnerships with our various sponsoring bodies. There are 10 priority areas of the National Health Policy, which I'll quickly make easier in the next slide. Okay? Leadership and governance, equity, access, quality systems, health facility training, strengthening, referral system and network, financing mechanisms, research, development and innovation, and intersectoral collaborations and partnership. Now, we have already set up the governing body at the governing organs at the national level. And we are in this process of completing the setup at zonal and state levels. In every state in Nigeria, we already have desk officers for eye health policies in Nigeria. And we have, in most states, we already have a state eye health committee. And we've also set up training programs, which I will mention where we've done them successfully in some different states in Nigeria to train people in various aspects of implementation of the National Eye Health Policy. Access, this probably is our biggest challenge. How do we ensure that everybody has easy access to the best form of ophthalmic services that they require? We need both infrastructure and personnel. We all know that ophthalmologists, for example, are concentrated in urban areas. How do we ensure that at least for the primary health care center, the primary eye care is made available to everybody at that level. And same thing with secondary and then tertiary. Quality systems, we've put measures in place to ensure quality control, quality assurance, and quality improvement. And we've set up a measurable and functional referral system through the data health information system, which I will talk about later, from primary to secondary and tertiary. So there's a two-way referral system which is set up, which will soon become operational. It has already been piloted in quite a number of states. Now, research, development, and innovation. The policy here is to define the research direction of Nigeria to achieve elimination of avoidable blindness. And our general aims are to conduct collaborative research, publish them, conduct and publish a national eye health survey. Now, the national eye health survey today, when it was costed, came to almost $1 billion US. And that would be very difficult. We actually had somebody, the former permanent secretary was willing to assist us to raise the funds, but that would be difficult. So we've settled for now to carry out what we know as rapid assessment of avoidable blindness surveys, about 12 in the country, 2 per geopolitical zones. And they have already started in some of the northern states already. Now, this is the National Eye Health Research Committee. And I'm sure you can see that the youngest person in the group here, can we see him? Okay. So, he's sitting next to me, but he's the youngest person in the group. And we had to put him there to teach us how to carry out the research that we require for avoidable blindness. You can see him as sitting with one of his sons. Where's Dr. Professor Lule? I think, Lusonya, sorry. He's sitting next to him here at the in our inaugural meeting in Abuja. Now, we are particularly interested in the World Health Organization resolution for integrated people-centered eye care, including preventable visual impairment and blindness, which was adopted by member states at the 73rd World Health Assembly. This resolution requested that WHO, in consultation with member states, prepare recommendations on feasible global targets, which we are already working on. And in fact, some of the results of our first meeting are already available with international funding agencies. I want to implement a framework to disseminate the eye health policy, ensure that it is adopted and adapted to different states and even the local government areas, and update the National Eye Health Strategic Plan, which we are hoping to launch during the World Sight Day this year, and then other implementation plans. This is a stakeholders meeting for the National Strategic Eye Health. Oh, it's not so clear here, but this Strategic Eye Health meeting, where we had people from all walks of life, including Federal Road Safety Corps, NAFDAC, also the various bodies, so that we have inputs from everywhere in planning how to implement the National Eye Health Policy. The monitoring and evaluation is very important. We've put measures in place to adequately monitor and evaluate all the steps we are taking and we will take to ensure that we achieve our aims and objectives. Now, the guidelines which we have already published include the performance standards for provision of child eye health in Nigeria, the first one, and it draws out criteria to measure the performance of child eye health providers working in various health facilities in Nigeria. We also have a treatment guideline for delivery of child eye health services in Nigeria. And then we have the National Primary Eye Care Manual, which is essentially a domestication of the World Health Organization Primary Eye Care Manual. And then the National School Eye Health Guidelines. As I said, the first set were focused on children because of their peculiar needs, children and adolescents. Now, the main purpose of the guideline was to provide a direction for those planning and implementing school eye health programs within the health and education sector. And it involves all professionals, teachers, parents, and children alike. Now, the guideline document provides a stepwise approach to developing and implementing school eye health program in Nigeria. And the steps are quite a number, beginning from the situation analysis of school education system and to establish the need for school eye health in that particular area, to the gap analysis, to detailed description of the program implementation using a Gantt chart, and implementing and monitoring the evaluation activities. And then the various stakeholders include the educational sector, because it's actually a collaboration between the Ministry of Education and the Ministry of Health. So the educational sector, the health sector, managers and development partners, as well as the finance stakeholders. Then, of course, I mentioned earlier that during the COVID era, we published the Eye on COVID, which was the practical steps to limit the spread of COVID-19 in eye health facilities and risk assessment for community eye care services. Now, we have practically finished the next set of documents, which are either rounding up or we have finished them. And we had hoped to publish them and to launch them during the World Sight Day, which is the second Thursday of October this year. One is the National Strategic Eye Health Plan, which details how we are going to implement all the plans from the National Eye Health Policy, stating also how the targets and the monitoring and evaluation policies for all of them. And then the domestication of the glaucoma toolkit, which is a guideline for how we should manage glaucoma in Nigeria. And of course, we know glaucoma is the leading cause of irreversible blindness. And then the guidelines for the screening and treatment of diabetic retinopathy. Now, the Ministry of Health is particularly happy with this because this is concluded, and it is probably the first one that was fully funded by the Ministry of Health. And I will tell you why later. All our other programs, we needed international partners to help us to sponsor them because there was no budget for eye health. Now, this is the Diabetic Retinopathy Technical Working Group. The meetings held at the Eye Foundation in Lagos. Then the stakeholders meeting. And these stakeholders also included people from the London School of Hygiene and Tropical Medicine. We had somebody from there, one of the faculty members present at the meeting, and then there were those who joined us from the United Kingdom and from different parts of Nigeria. So from the United Kingdom and quite different parts of Nigeria were together to prepare the guideline for management of diabetic retinopathy in Nigeria. The glaucoma toolkit also followed the same method. We had a technical working group. Fortunately, there was already a toolkit for sub-Saharan Africa. So all we needed to do was to domesticate it for Nigeria. And then the expanded stakeholders meeting to conclude the work. And then we had other tools. Now, before now, the health information system in Nigeria had nothing about eye care. So we had no choice but to get the people involved that eye health was important enough to be among the data tools that will be collected for Nigeria from the primary health centers through the secondary health centers to tertiary health centers to the Ministry of Health, so that we can have continuous data for planning and implementing government policies. And we have successfully done that. And we're in the process of putting a lot of our diseases into the data health information system platform 2. So there are 8 indicators, 7 registers, 2 forms, and monthly summary forms. We have piloted some of them in 11 facilities, 4 primary, 4 secondary, 3 tertiary centers in 6 states, 1 per geopolitical zones: Nasarawa, Bauchi, Kano, Oyo, Anambra, and Cross River states. I already mentioned where the roles and responsibilities for the states, the federal workers have already been properly outlined in the program. And this is the National Health Team with the partners planning, we're actually planning for the World Sight Day 2023. Advocacy has been one of the major tools by which we've achieved what we've been able to achieve. The World Sight Day 2022 gave us the opportunity to pay a visit to the Senate, where we met with the Senate leaders, and then the House of Representatives too, where we met with the Chairman House Committee on Health, and were able to get promises and assurances for support to establish laws based on the National Eye Health Policy. Well, we also visited some states. I'm sure most of us can remember Professor Akin Abayomi of Lagos State, of the COVID, who was in the forefront of the COVID fight in Lagos. And then, recently, we were able to visit the President of the Federal Republic of Nigeria. That's President Bola Ahmed Tinubu. And he made certain promises, which I'll talk about very quickly. Now, we have many collaborators and partners who have helped us to achieve what we are trying to achieve. Most importantly, Sight Savers International, CBM Global and International, T.Y. Danjuma Foundation, National Eye Health Center, National Eye Center, Kaduna, recently Peak Vision, the IAPB World Health Organization, the London School of Hygiene and Tropical Medicine, DRONet, and then other ministries who we have partnered with. Ministry of Education, Transport, Environment, and Defense. I'll mention them quickly. Now, collaboration. One of the problems we've had in ophthalmology was the ability to bring the 4 groups responsible for eye health together. And we have always had difficulty because they've always been competitors rather than collaborators. For once, we were able to achieve that successfully. In 2022, we were able to bring the ophthalmologists, the optometrists, the ophthalmic nurses, and the dispensing opticians under one umbrella, and we celebrated the World Sight Day together for the very first time just last year. This picture shows the president of the Ophthalmological Society of Nigeria, the president of the Nigerian Optometry Association, who is now the registrar of the board of optometrists, the president of the ophthalmic nurses, the president of dispensing opticians, and myself were together in Abuja to celebrate the World Sight Day together. And even at the state level, we'll see for the first time, there is no way the government can do this on their own. At the national level, we have done our own primary eye care training at the national level 1, and then in certain states, 5 states actually, Katsina, Kogi, Plateau, Rivers, and Kwara. And we've done training for state-level trainers for all the states of the Federation, particularly the North Central and the South-South. We'll soon be coming to the Southwest to do the training program. Now, I want to bring this, which just happened just a bit over a week ago, but we've been working on it for quite some time, our collaboration with Peak Vision. And Peak is it's a device which is a fast screening artificial intelligence device for refractive error that has been used widely in many parts of East Africa to enhance school eye health programs and primary eye care integration into the primary health care systems. We're able to invite the the founder of that organization, who is also the co-founder of the Vision Catalyst Fund, to Nigeria. And the Vision Catalyst Fund assists governments and collaborates with private sector and NGOs to integrate eye health into issues such as education and employment. As part of its ongoing commitment to eye health, the One Sight Essilor Luzotica Foundation, which is one of the partners of the Vision Catalyst Fund, aims to donate 200 million pairs of glasses to partners and programs working to eliminate poor vision through the Vision Catalyst Fund. That is Andrew Bastauros, who came to visit Nigeria just about a week ago from the United Kingdom. This picture was taken in the Ministry of Health, Abuja. He's an ophthalmologist and a lecturer in the International Center for Eye Health and the London School of Hygiene and Tropical Medicine. As I mentioned, he's also a co-founder of the Vision Catalyst Fund. Now, the advantage or the benefits we had from the visit that we were able to visit Mr. President, where he promised an initial donation of 5 million pairs of glasses to be distributed free to Nigeria through the National Eye Health Program and the Federal Ministry of Health. Now, the provision of technical support to unlock World Bank funding, especially in the areas of implementing school eye health programs in Nigeria. Now, by that singular action of our visit to the president and the information to the funding world and the World Bank, he has successfully initially been able to unlock 500,000 pounds sterling for Nigeria, of which 100,000 pounds sterling is earmarked for our celebration of the World Sight Day of 2024. I'm sure this picture was probably the most popular picture last week, both in Nigeria and in the finance committee, because the World Bank and everywhere had this picture just last week. And it was quite viral and everywhere, where we met with the president, his new Minister of Health, present in that meeting with some of the partners of the eye health care. Well, the news was viral, and I'm sure many of you must have heard some of the statements that the president said. When I came out, everybody kept asking me, how is the president? How is the president? Well, interestingly, he was sound. He was. Because he sat down, he listened to us, and he spoke without any paper, and spoke to us and made some of these statements. Andrew told him about his problems. He was regarded as a dullard, a failure in school, until he was around 12 years or so, when he was tested and he found that he needed glasses. For the first time, he stood and saw the leaves in trees. He didn't know there were leaves before in trees. He just saw something big, hazy, and all that. And then suddenly he became good, became the best student, and then became a professor of ophthalmology. So when he said that unlocked the president to tell us about his own story concerning eye health. And that is the story there. My mother of blessed memory was ill, couldn't recognize me. I took her to the United Kingdom for treatment. She was treated and given a pair of glasses. The next question she asked me was, I have you, and you are able to do this for me. What about those other women and their children who may not have somebody like you? He said this directly to us. I'm quoting him exactly. So I made a promise that I will pursue the vision eye care vigorously. That will provide free eye screenings and surgeries to people because of the question my mother asked me and her passion. I'm sure some of us will have heard about Jiggy Bola, the program he launched in Lagos State about 20 years ago, where he provided free eye health services. In fact, when I got to my seat, I saw Jiggy Bola on my table. I was wondering, what is Jiggy Bola? I just couldn't, I don't speak Yoruba, so I couldn't understand what Jiggy meant. So he also said, we touched several people in Lagos, and you could see the joy in them with improvements in the eyesight when they were given a pair of glasses. But the part that is most important to us was this: I am in support of this initiative and will encourage the mobilization of further commitments to see this through and to reach the vulnerable people in our country. Some parents may not pay attention to this, but I will do because I am touched. So we have indirectly gotten a commitment for the president to attend and be present and mobilize support for our next this year and next year, the World Sight Day. Now, how we're going to achieve that, I don't know, but God willing, we will. Okay, eye care providers were told that they must learn to. We expect that all eye health providers will have to follow the practice guidelines which will emanate, because it's not just the Ministry of Health doing it, it is us. We get as many stakeholders from amongst those of us in eye health to work on them and produce the information using the relevant data that is available to us. Now, the National Health Policy has certain policy statements which are very important, which I will quickly rush through. the government shall provide eye health services that are people-centered according to the needs to ensure access to quality eye care services, recognize the reality of traditional, informal, spiritual, and religious service provision, including the street vendor, and determine strategies to strengthen, collaborate with good, ignore the harmless, and eliminate the harmful. Address geographical, gender, cultural, population, and financial equity. Address equity to access by persons living with disabilities, the poor, the elderly, women, and children. Ensure fairness in service provision and distribution. Standardize eye medical and surgical treatment for all, regardless of ability to pay. Ensure the provision of eye care for sight-threatening injuries and eye conditions requiring urgent care, regardless of ability to pay. I'm sure you will see that we have given ourselves a mountain to climb. But Rome was not built in one day. We intend to get there one day. What have we achieved so far? Governance policies. We have at least produced a national health policy which contains all that. We have desk officers appointed for all states, and yes, for all states, desk officers in all states' ministries for this. And then the states' eye health committees have been set up in almost all the states, just a few left. The strategic plan is already operationalizable. We're already working on many parts. And many of the things you saw us do when we're working on diabetes, glaucoma toolkits, the strategic plan are all outputs from the national eye health policy. So we already started doing that. And we're mobilizing resources for human resources for eye health, especially in rural areas. The health system strengthening, task shifting, task sharing, referral pathway have already been established, and we're ensuring that at least in every ward there's a primary eye available, all in one roof. And then the Health Management Information System of Nigeria, the Data Health Information System 2, now includes eye diseases. And then disease-specific programs, I guess, which I mentioned, diabetic screening plan and treatment guideline, which we hope we'll be launching in by next month. And then a glaucoma toolkit domestication, which I don't know, we're hopeful that we can do that too. Education, the training we're already doing in communities in different states, we've already done in 2 geopolitical zones completely. We have 5 years actually, it's part of the 5-year plan, and we hope to complete all and do them subject to the availability of funds. Now, the permanent secretary for Ministry of Transport was then an ophthalmologist. So we used that for celebrating our World Sight Day last year. The Ministry of Education for water, sanitation and hygiene, as well as disease control, World Health Organization toolkits. We've also collaborated with the Ministry of Defense and Humanitarian Affairs in our work with the IDPs. And then the use of telemedicine for ICT. We have using that already, both for the management of diabetic eye health program and all that. So we want to achieve universal eye health coverage in Nigeria. We want to have optimal eye health care for everybody, to be free from avoidable vision loss and blindness, and then people with vision loss to develop their full potential in an equitable manner. Now, what is health equity? I'll just please make one sentence about that. Health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances like ability to pay. It is not the same thing as equality. It is not equity to simply provide everyone with the same resources. That will be equality. To achieve health equity, resources must be allocated based on an individual need principle. Financial risk and sustainability. People have always asked us, how are you going to sustain this? Even if you get it started, how will you sustain? Now, so far, all we've been able to achieve is to leverage on the National Health Insurance Agency and to hopefully encourage all states to have their state health insurance schemes, which we hope will continue to increase in coverage to include people. people don't really realize that any group of people, of 20 or more people, can register and be part of the National Health Insurance Scheme. People don't know that. But we need to do further education to ensure that any group of people can achieve that. There's also a basic health care provision fund, which is equally as rich for primary eye care services. I made a mistake. I would have brought a massive building in my hospital, University of Unity Hospital, where we're able to get funds from this basic health care provision fund to build a big building for, I shouldn't reveal this, hope there's no press person here. The new ophthalmology center, about 4-story high, is coming from these funds. If you know how to mobilize for it. I'm sure those who have come for accreditation in Benin have seen at least the structure up already. I think Dr. Ajaiyeoba is here. I think he saw it when he came to Benin, if I'm correct. Then, increase in government funding for eye care, information of policies and guidelines, like what's happening in the diabetic retinopathy program booklet, which we're about to launch. Tax relief and waivers for all eye care equipment by the federal government of Nigeria, which we hope we will achieve before the end of this year. And donor agents, grants from donor agencies. I already mentioned one, and we have hope that if we meet the distribution targets that is set, we are hoping that yearly we should be talking of nothing less than a few millions of pounds yearly for eye care in Nigeria that will be donated just from the World Bank. Now, our major limitation till now has been funding. This is a meeting of our committee with the former Permanent Secretary, Ministry of Health. At that time, that was 2022, there was either no line for eye health in the Ministry of Health, or if there was at all, it was never funded. And we're able to get the PAMSEC to commit to that. And now we have very meager sum, 0.00002% of the health budget for eye health. Now, it's from zero to that. Now, I won't tell you how much that is. However, in our visit to the president, we're able to tell him that in most African countries, eye health consumes up to 1 to 2%. Can you imagine the jump from 0.000002 to 1% or 2%? That's like 10,000 times the current funds available to us for eye health. And he has committed himself that he will achieve it. So we hope that he will keep the promise. So our conclusion, all efforts must be made to ensure all Nigerians to assure all Nigerians of government's commitment to the implementation of the national eye health policy and solicit the support of all stakeholders, including all of us here, in its implementation to ensure the achievement of the universal eye care services towards universal health coverage in Nigeria. It's imperative for the federal, state, and local governments and FCTA to implement the National Eye Health Policy 2019. Ophthalmologists and other healthcare professionals should be interested and participate at all levels. I want to clearly acknowledge the Almighty God again, because as you all know, the working life is a path sown with thorns and laden with mines, and it takes the grace of God Almighty to finish it successfully with a sound state of mind, body and mind, a good name and an unblemished record. Therefore, we want to thank God for the life of our celebrant, Professor Ajaiyeoba, who has been able to achieve this. I want to also thank everybody present here for taking out time to be present, and then for everyone who has played a role in the life of Professor Ajaiyeoba, or institutions where he has worked, not just the Premier University and Hospital, the National Postgraduate Medical College, West African College of Surgeons, and every other place. I know he has done sabbatical in even Lagos University Teaching Hospital and quite a number of other places, and places outside Nigeria. They've all helped to mold the perfect gentleman that we see before us today. Well, I had to take permission from my wife, who not only permitted me to come, she brought me herself. So without calling anybody's name, let me at least acknowledge her, so when I get back home, she will look after me well. That is, she's Professor Caroline Omoti. She's a professor of hematology in the University of Benin Teaching Hospital. Now, let me please pay tribute to the generation of Professor Ajaiyeoba. In paying tribute, let me borrow from Konak Gotch in his genius quote, "The elderly," shared in LinkedIn in March 2023, as modified by Professor A.O. Obasanjo, former CMD, UBTH, who employed me as a consultant in his valedictory lecture, which took place just about 2 weeks ago or so, and with further modifications from me. Sir, you were born somewhere in the 40s, 50s, 60s, and grew up in the 50s, 60s, 70s, and studies in the 60s, 70s, and 80s. You were dating in the 70s, 80s, got married, ventured, and discovered the world in the 80s and 90s. Stabilized in the 2000s, got wiser in the 2010s. And you are going firm through the 2020s. It turns out you have lived through 8 different decades, 2 different centuries, 2 different millennia. You have gone from telephone with an operator for long-distance calls to video calls to everywhere in the world. You have gone from slides to YouTube, from vinyl records to online music, from handwritten letters to typewriters to email to WhatsApp. You saw man explore and go into space in 1957, man landing on the moon in 1969, space laboratories built, and an international space station built in space. Man is now exploring Mars and Jupiter with inquiry. From live matches on radio, like those days we listen to all our commentaries on radio, to black and white TV. I'm sure everybody knew that bang, 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 bang at 4 o'clock, about time. Color TV and high definition and 3D TV. You went to cinema, to video clubs, and now you can now watch Netflix. You got to know the first computers, typewriters before then anyway, punch cards, diskettes, and now you have gigabytes, megabytes in your hand on cell phones and iPads. You wore shorts throughout your childhood. Well, that's if you had shorts to wear. And then long pants, Oxford, Bermuda, Labu, everything up to now. But I can assure you, he's not going to wear, what do you call it again? SAG. But you saw the people wearing SAG. You dodged infantile paralysis, meningitis, H-flu, and recently COVID-19. You rode skates, tricycles, invented cars, bicycles, gasoline, or diesel cars, and now you are in the era of hybrids or 100% electric cars. Yes, you have been taught, you have been through a lot, but what a great life you've had. You could be described as exennials, people who were born in the world of the 50s, who had an analog childhood and a digital adulthood. Others will call you baby boomers. You are kind of your senator. Your generation has literally lived through and witnessed more than any other in every dimension of life. It's your generation that has literally adapted to change. Can we give a big round of applause to every member of this generation? Okay. Well, my references are few. Let me just quickly rush through them. And then, for eye health in Nigeria, please sit down, please. For eye health in Nigeria, the task is onerous. It is difficult, and fortunately for us, we have taken the first steps, and they are giant strides. It will not be easy, but we will get there. Thank you very much.
Can we give a standing ovation to our speaker? A big round of applause for him. You may please be seated. Thank you all. What a lecture, and what a way to end it. Well, that's a generation I just celebrated. Generation that writes their notes themselves. Prof has been writing since the beginning of that lecture. You know, when I give lecture to medical students, and I look at them, they are not writing anything, and I'm like, So I had to devise to say at the start of my lecture, I'm not going to give you my slides, I'm not sending to your mail, to see whether they will bring out their pens and papers. Because the generation that taught us, you will be tired if you don't have a note that is well written. Ladies and gentlemen, another round of applause for our guest lecturer. And much more, a round of applause for Professor Ajaiyeoba for being part of all of this that has been listed. He's a true son of the soil, Ibadan. Abi, mo ti sọ lẹ́ẹ̀kan pé yìí ni májàmájà tó fi kó ara wájú lẹ́rú. Ìlú Àjàyí, Amáraìsà, ìlú Látòsà, Abi. So I'm correct. Ladies and gentlemen, welcome with me the chairman of today's occasion, Professor Olorin, as she presents a plaque to the guest lecturer of today. A round of applause for her.
Thank you. Thank you very much. I have not listened to a lecture that inspired me so much in many years. It looks as if there's any lecture like this, I might come. It's been a really fantastic lecture. Not just for what Professor Moji has been able to put together, but he has opened our eyes, the eyes of the older ones and the eyes of the younger ones, that there is more to ophthalmology than the departments of ophthalmology, than your house job, than your residency, than your writing a few papers to become professor of ophthalmology. He has opened our eyes that ophthalmology becomes part of you, and you must become part of ophthalmology so that the whole world benefits from whatever knowledge you get in the classrooms and in the field. I really am so delighted and so impressed. Thank you very much. I was going to say I wish I was 50 years younger so that I can follow your path. But for heaven's sake, it will take a long time for one to be able to go through all this. You were lucky, and you are blessed that you have been able to impart this to other people. Thank you very much for your lecture. It's my pleasure to give the Ophthalmology Department's Distinguished Award of Excellence presented to Professor Afekide Omochi in recognition of your immense contributions as keynote speaker at the Grand Round titled, I can't read that, Eye Health in Nigeria on this 8th day of September 2023. Thank you very much.
A round of applause for our chairperson. Okay, so I want to quickly run through these recognitions. We'll take some Goodwill messages and we'll close. So the aim is to finish in about 30 minutes. You can time me and let me know when my time is up. And if I don't agree, you can take me to court. Ladies and gentlemen, welcome with me to our midst this morning. The young lady that released the young man that gave us a lecture. And according to him, she didn't just release, she supervised the movement so that the parcel is delivered safely and soundly. Welcome with me, Professor Caroline Omoti. A round of applause for her. You are welcome, ma'am. And of course, we have other people that I would quickly like to run through. Dr. John Dongo, a round of applause for him. Dr. Badio Gundipe. A round of applause for him. He's surprised that I'm recognizing him. But the celebrant asked that I recognize you separately. Venerable Oluwajo, Anglican Communal Ibadan. A round of applause for him. Professor Dupe Popola of the University of London Teaching Hospital, a round of applause for her. Dr. Gani Adeniro, a round of applause. Professor Adenike Ado, a round of applause. And of course, I want Professor Ayotunde Ajaiyeoba, a round of applause for her. Permit me also to recognize in our midst our elder, Chief Taye Ayorinde, the Baale of Oketedo. You are welcome, sir. You are wonderfully welcome, sir. Ladies and gentlemen, we move quickly to the reading of the citation of the celebrant, and then we take Goodwill messages. Please, I know the citation is about 20 pages. You give us the abridged version, because the time allotted to you is about 3 minutes. Ladies and gentlemen, welcome with me for the reading of the citation of the celebrant, Professor B.A. Olusoya. A round of applause for him.
Thank you very much. My grand teacher, chairperson of the occasion of today, an August occasion that we are holding in the month of September. I am honored to be privileged to give this citation in honor of our celebrant of today, Professor Ayotunde Ajaiyeoba, whom I would now humbly request to stand. Thank you, sir. I would also crave the indulgence of the chairperson to stand or kneel on existing protocol that has already been laid by the chairperson. Thank you very much. Because I feel like kneeling down because I'm not comfortable standing beside this giant. But I would try. Today we gather not merely to honor an accomplished individual, but to celebrate the extraordinary life and contributions of a true luminary. The distinguished celebrant of today has left an indelible mark in the world of academia, clinical medicine, and ophthalmology. Allow me to introduce to you the remarkable Professor Ayotunde Ajaiyeoba. Imagine a life dedicated to the pursuit of knowledge, a career marked by relentless discipline and accomplishments that have transformed the landscape of medicine. Today, we step into the inspiring world of a true titan in the field of medicine, a man who is about to embark on a well-deserved retirement. Professor Ajaiyeoba was born on this very day in 1953. He is the third child and the only son among 5 siblings of Mr. Isaiah Dudola Ajaiyeoba, hailing from Itutaba, and Mrs. Meili Munilola Ajaiyeoba Ni Akidele from Aremo, both in Ibadan. He attended St. Luke's Demonstration School, Molite, Ibadan, from 1960 to 1965, before proceeding to the Ibadan Grammar School, Molite, Ibadan, from 1966 to 1970. He later proceeded to the Comprehensive High School, Ayotunde in Ogun State, for his higher school certificate between 1971 and 1972. His academic journey continued at the prestigious University of Ibadan in 1973. Armed with ambition and determination, he pursued that degree of Bachelor of Medicine, Bachelor of Surgery, completing it in July 1978 and receiving honors as a federal government scholar, as well as the Oyo State government scholar during the period. He served his internship at the Ajaiyeoba Hospital from 1978 to 1979 and underwent the National Youth Service at the Evangelical Church of West Africa, Kano, between 1979 and 1980. From this point forward, he embarked on a remarkable voyage within the field of ophthalmology. In 1980, he returned to the University College Hospital for his residency training in ophthalmology, and in 1985, his quest for excellence led him to the ophthalmology department at the Royal Victoria Hospital, Queen's University of Belfast in Northern Ireland for an overseas clinical training in ophthalmology for 1 year. During this period, he also accepted the role of an educator, imparting his knowledge to Part 4 MBBS students in ophthalmology. After the completion of this invaluable clinical attachment, he was extended an appointment as a senior registrar in ophthalmology. However, true to his patriotic spirit as a Nigerian, he humbly declined this offer, returning to Nigeria in 1986 to prepare for his final fellowship examinations in both the West African College of Surgeons and the National Postgraduate Medical College of Nigeria, which he sat for and passed in flying colors in April and May 1987, respectively. He thus became the first fellow by examination of the West African College of Surgeons in ophthalmology. Professor Ajaiyeoba's pursuit of knowledge did not end with the acquisition of the MBBS and fellowships in various faculties of ophthalmology. Indeed, to his treasure trove of professional qualifications, he added the fellowship of the International College of Surgeons in 1997. He continued his academic journey, earning a Master of Science degree from the University of London, United Kingdom in July 2000, and later an MD from the National Postgraduate Medical College of Nigeria in December 2020. His relentless pursuit of academic excellence is a testament to his commitment to lifelong learning. In May 1987, he was offered a position as a lecturer, one and consultant ophthalmologist, Department of Ophthalmology of the University of Ibadan and the University College of Hospital Ibadan. And he ascended through the ranks, achieving the position of professor in October 2006. His dedication to the field was further exemplified by his unopposed election as the 13th Dean of the Faculty of Clinical Sciences, a role he dutifully fulfilled between 2010 and 2014. His influence extended far beyond the university and hospital walls. He was not just an academic clinician, he was a global health contributor who served as a World Health Organization consultant for xerophthalmia and conjunctival impression cytology in 1995, shaping the understanding of eye health and impacting countless lives worldwide. He was also a consultant to the International Vitamin A Consultative Group, a member of the editorial board of the Nigerian Journal of Ophthalmology, and a reviewer for several international scientific journals. That's not all. His commitment to medical education is truly exemplary. His role as a mentor and supervisor of numerous postgraduate students during their secondary training has been pivotal in shaping generations of ophthalmologists. Several of his mentees have risen to become professors themselves, including yours truly. His over 35 years of teaching experience at the University of Ibadan University College Hospital exemplifies his dedication to academic excellence. As an examiner, he has been a guardian of academic standards, ensuring that medical students undergo rigorous evaluations, producing graduates who are not just knowledgeable, but exceptionally skilled and ready to face the challenges of the healthcare profession. Professor Ajaiyeoba has been instrumental in the accreditation of medical programs across the country, ensuring adherence to the highest standards of medical education. His dedication extended to serving as the faculty secretary of the Faculty of Ophthalmology at the National Postgraduate Medical College of Nigeria between 1995 to 1999. He has played pivotal roles as a leader in the university sphere as well. He served as the head of the Department of Ophthalmology, as Dean of Faculty of Clinical Sciences, and a prominent member of the University Senate, contributing to the university's growth and development. We cannot but mention his prolific research endeavors, which have yielded scores of peer-reviewed articles. Professor Ajaiyeoba's work on child ocular health, particularly on vitamin A deficiency and xerophthalmia, has been revolutionary. His studies on conjunctival impression cytology and childhood eye diseases in Nigeria have not only deepened our understanding of eye health, but have informed critical public health initiatives. His dedication has not gone unnoticed, as he has earned numerous accolades and appointments, including his award as a distinguished scholar for outstanding academic research by the European Journal of Scientific Research in April 2005. He continues to make contributions, valuable contributions, to the research and public eye health policy in Nigeria as a member of the National Eye Health Research Group, just like the lecturers educated us earlier. Behind this impressive list of achievements is a man of character. His colleagues and students often speak of his integrity, compassion, unwavering commitment to his patients and students. He embodies the values that medicine and education hold dear. Beyond his illustrious career, he shares this life outside the walls of hallowed walls of academia. He's an active member of the Seventh-day Adventist Church. He loves playing football and tennis, and he listens to cool melodies, another dimension to his multifaceted personality. He's happily married to Professor Edith Oreabure Ajaiyeoba ni Osehuemen of the Faculty of Pharmacy. Today, as we honor Professor Ajaiyeoba, we do more than his impressive resume. We celebrate the profound impact he has had on the academic and ophthalmology world. The countless lives he has enriched, his legacy will continue to inspire future generations of medical professionals. Let us use this occasion to express our heartfelt gratitude to Professor Ajaiyeoba for his monumental contributions to medicine, his tireless dedication to knowledge, and his unwavering commitment to societal betterment. May his well-deserved retirement be a chapter of joy, relaxation, and knowledge that leaves behind a legacy of excellence and compassion. Ladies and gentlemen, please join me in giving a standing ovation to Professor Ayotunde Ajaiyeoba. Thank you very much.
Let's keep the ovation going. A round of applause. Let's keep the ovation going. Thank you very much. This is the part where the bata drummers are supposed to enter. But they have removed subsidy on cultural troops, so we decided to excuse them. If you've done this much work, you deserve all the drums. And I know that we are going to roll out the drums anytime from now. But we don't want noise in the hospital. We'll take our drums to where we can beat it. And because he loves cool music, we'll make the music cool for him. Ladies and gentlemen, another round of applause for an achiever. Man who's done so much work, yet he still has so much to do. Permit me, on the request of the celebrant, to quickly recognize these people. I'm going to run through it. First, the chairman, secretary, and all members of the National Postgraduate Medical College, Faculty of Ophthalmology here. A round of applause for them. Also, he wants me to recognize Captain and Mrs. Abi Doye. A round of applause. Professor Nobolu, Professor Chibode, Professor Peju Ayelagba, Professor Ayelagbe, okay, sorry, thank you. Professor Ayelagbe Jolu, that's my teacher. A round of applause for him. Mrs. Taye Ogundiro, Mrs. Ogundairo. Okay, I think it's safe not to read out these names, but Celebrants, I tried to read out Mrs. Feyi Olaleye, Professor Sarah Wojo, and Professor Mrs. Falusi, and all other names. Believe me, you are all appreciated for coming here today. Well, Professor Ajaiyeoba has done so much, and I don't think there's anything the department can say that can particularly thank you enough. Just like we have not finished thanking Mama Olori till tomorrow. I don't think they will ever stop thanking you. But of course, they want to appreciate you by presenting you a plaque this afternoon. Ladies and gentlemen, welcome with me the head of department, Professor Oluleye, as he presents a plaque to the celebrant of today. A round of applause for him.
Okay. Hey, I want it. We want our mommy to present the award.
To my friend. Right. I say to my friend, to my neighbor. His office is right next to mine. The entire staff felicitate with you on your retirement and 70th birthday. This is truly a remarkable milestone that you have achieved, and it's a testament to the incredible dedication and hard work you have put into your career. Congratulations, Professor Ayotunde Ajaiyeoba, presented on this day, 8th of September 2023, by the Department of Ophthalmology. Congratulations.
A round of applause for him. Prof. Well, that's another first. How many people get plaques with their pictures on it? You can see now. Be like Ibadan. Ladies and gentlemen, we'll take very few Goodwill messages because we still have to allow for time for the Muslims to get to the mosque. I'll be starting with the Vice Chancellor. I'll crave the indulgence of the Vice Chancellor to help us make it 2 minutes so that we can finish on time.
The chairman of the occasion, Professor Onyade Oluri, my mentor, and the reason why I studied medicine and went into ophthalmology. The provost, the CMD, CMAC, the college secretary, my HOD, the guest lecturer, the celebrant, and his entire family. Ladies and gentlemen, I read this goodwill message on behalf of the Vice Chancellor, Professor Kayode Adeboale, FAS, MNI. Today, we come together to celebrate a remarkable individual, an esteemed colleague, and a genuine visionary, Professor Ayotunde Ajaiyeoba. As the Vice Chancellor of the University of Ibadan, it's both an honor and a privilege to stand before you today to pay tribute to a professor who has made an enduring impact on our institution. We gather here not only to mark his well-deserved retirement, but also to celebrate his birthday, making this occasion all the more special. It's a joyous confluence of milestones, and we could not be happier to be part of it. Throughout his illustrious career, Professor Ajaiyeoba exemplified the very essence of academic excellence. His journey with us began in 1987, and since then, he has achieved numerous milestones that have significantly enriched our institution and the field of medicine. He has served as head of Department of Ophthalmology, as well as the Dean of the Faculty of Clinical Sciences. His legacy as an educator is equally profound. He has been a guiding light for countless students who have had the privilege of learning under his tutelage. He has been a mentor, a role model, and a source of inspiration for many. His commitment for imparting knowledge, instilling discipline, and fostering a love for the art of healing has left an indelible mark on all those fortunate enough to have been under his guidance. As we celebrate his retirement, we also recognize that his journey doesn't end here. His legacy will continue to inspire generations of medical professionals, and his contributions to the field will endure. We look forward to witnessing the continued impact of his research and the lasting influence it will have on the practice of ophthalmology. As you embark on this new chapter of your life, Professor Ajaiyeoba, we extend our warmest wishes for a retirement in contentment, serenity, and the pursuit of new passions. In closing, I want to express our deepest gratitude to Professor Ajaiyeoba for his monumental contributions to medicine, his tireless dedication to knowledge, and his unwavering commitment to the progress of this university. Your legacy will forever be etched in the annals of our institution, inspiring us all to strive for excellence and compassion. Let us celebrate an extraordinary man, his impressive accomplishments, and the person he is: intelligent, compassionate, and dedicated. Thank you very much.
Thank you very much, ma'am. May I then respectfully call on the Provost of the College of Medicine, University of Ibadan, as she gives a Goodwill message.
You want him to say 2 minutes? Let me adjust myself. Thine, O Lord, is the greatness and the power and the glory and the victory and the majesty. For all that is in the heaven and in the earth is thine. Thine is the kingdom, O Lord, and thou art exalted as head above all. The Vice-Chancellor of the University of Ibadan, Professor K.O. Adibowale, FAS, MMI, ably represented, I would say, by one of the grandmothers or mothers of ophthalmology, the Deputy Vice-Chancellor Academics, Professor Aderonke Bayeroju. Thank you so much. I cannot lean on existing, I'm the host, chief host, so I have to go through protocols, and you will excuse me. The chairman of this event, Nigeria's foremost ophthalmologist, a teacher, never forgotten the teaching that I had when I was a medical student. And I must acknowledge, I remember you used to spend maybe about 10 minutes with us, but those 10 minutes would be so impactful. What you used to do then in the clinic was you would select about 5 cases, and then you would invite us in and take us through the cases, and then we would go. It was really wonderful. And your daughter also happens to be my contemporary, Professor Oyin Olori. I acknowledge you. The Chief Medical Director, ably represented by Dr. Adeoye. And I must mention all my teachers, mentors here, living legends. So many of you are here. I must also acknowledge the former ICOMA president, Dr. BGK Ajayi, the chairman and chief executive officer of a Letter I Foundation. Thank you so much for all you do. You are one of our supporters in the college, and we cherish you dearly. God bless you, sir. Thank you so much. And then the keynote speaker, Professor Ernest Omoti, and his wife, Professor of Ophthalmology from the University of Ibadan. Both of you, thank you so much. I learned so much. You gave an excellent lecture showing the importance of grassroots. Grassroots impact is awesome. And one of the questions I had for you, unfortunately there was no time for questions, but you were mentioning the amount of money being spent on eye health, that 0.0000. And a question I had was, why isn't there a way in which it can be integrated? Because it needs to be integrated. You can't have eye health on its own. Eye health is very closely linked to mental health, nutrition, And that approach may actually be more impactful, having an integrated approach generally at the grassroots, as opposed to having a lot of vertical programs. And I believe it to save the country from a lot of issues and money. So I wrote it down here. Secretary to the college, Mr. Odedele, and all members of the college executive. I can see many of our deans are here. I know the director of the Institute for Advanced Medical Research and Training, Professor Ayotunde Ajaiyeoba, acknowledge you, and of course, the head of department of ophthalmology, and all members of the department who have put this wonderful program together. And of course, the reason we are gathered here in this room, Professor Ayotunde Ajaiyeoba, and your beloved wife, Professor Edith Ajaiyeoba, and your blessed children, Dr. Dami Wenchi, MBBS class of 2011, Dr. Ayotunde Ajaiyeoba, College of Medicine, MBBS class of 2011, Engineer Opeyemi Ajaiyeoba, and of course, Miss Atinuke Ajaiyeoba. I celebrate all of you. God bless you. A full and comprehensive LOC chair. I'm speaking, you can't be speaking. No. A full and comprehensive achievements are already all over the social media. And I wanted to just pick out some things that I found very instructive. One of it was that you were born into a devout Christian family. And I believe that gave you a really good head start. And then you were the only son, and you had 4 sisters. I think that must have helped you in your life journey. Because having to cope, and then you were a middle child, with so many women among you, must have been very, very, very instructive. Because you know, we women are very complex and very interesting, and you survived it all. Yeah, but I don't know if any of your sisters are here. Are your sisters here? Let the sisters stand up. Yes, sisters. Awesome, awesome. I acknowledge you. You must have really given him a lot of excellent ideas, because there's nothing like being among wonderful women. And of course, you are a son of the soil from Ibadan. Your mommy from Ibadan, your daddy from Ibadan. I was just wondering, you know, but you know, it's interesting, because even though you had such a strong Ibadan heritage, one of the things I wanted to mention about you is that I see you as a citizen of the world, completely detribalized and open and embracing all. And these are virtues that are greatly needed in our nation at this time. Yes, so I think that's, you know, you must have had a lot of exposure to open your heart and your mind. And I must acknowledge your parents who raised you to be a giant in your field. Yeah. I also observed that you had several scholarships. You were favored. You had a lot of, you know, scholarships. Of course, from your brilliance, but then it's also favor. Because many people who are brilliant don't have that kind of access. So you are a privileged Nigerian, and we must acknowledge God. And then you had a lot of honors, you know, and you were selected. There was, I can see that in 2006, you were the nominee for pediatric ophthalmology. You were honored at the World Health Organization, you know, and so many other things. And you were sent to train in India. And that in recognition of your exemplary service and contributions, you were honored as a distinguished scholar for outstanding academic research by the European Journal of Scientific Research. So you had a lot of opportunities, and you were really honored. I want to mention a couple of, you know, you became dean of the faculty from 1st August 2010 to 31st July 2014, and you served meritoriously. One of the young men who served with you, that's the head of administration in the provost office now, he said you were very, very, you were a leader to them, you were approachable, you were kind, you were visionary. And I noticed that today he wore a special outfit. So you must have made a great mark in the eyes of a young administrator. Thank you. But then I just want to say some of your qualities. When you were dean, and I mentioned this, you were unafraid to voice out and stand for the truth, even in the most difficult situations in leadership. I can't give the full details, but I'm sure you remember. There was a certain day, there was a situation that arose in my department. I wasn't a professor then. I was, but me, when I had seen there would be trouble ahead. So I contacted the provost. The provost was attending UCH board meeting, and he asked you to sort it out. And we came to your office. And honestly, you saved my department from years and years of turmoil. And you used much wisdom, because I believe everyone that came meant well in their own way. But there were certain insights that you had. And you used the example of University of Ibadan. I don't know if you remember. You used it as an illustration. And I think that did it all. You used wisdom, you used understanding. You took your time, you were patient, you listened through. Before I came, I was standing as a loner in my department. But by the end of the day, you gave your verdict, and I'm very grateful to you. Yeah. I'm sure many of the younger ones will appreciate it better now. And then I must also appreciate you for, you were very supportive of your wife. You the place, giving me information. Nothing but my biggest. Let me go on, but I just support inspirations and expressions, because I know her to be a very distinguished professor of pharmacognosy, a leader in her field with numerous grants. She helped to raise up the university's ranking. She was the first African woman to utilize the Alexandra von Humboldt's Fellowship in Natural Products in Chemistry. She was the first Nigerian female to utilize the African Senior Fulbright Fellowship in Natural Products Chemistry. I know that God will answer your prayers when you deal kindly with your wife. And then you are a lover and mentor of your children. I knew your children from when they were small, when they were in ISI, because they were a bit close to my son. And your family is very close-knit. And the children will fight. You can't get in between them. They stand together as a block. And honestly, and two of your children are worthy graduates of the College of Medicine, revealing years of outstanding nurturing and investment by yourself and your beloved wife. More your beloved wife, yeah. And I'm going to showcase your wonderful children, who are our pride. And I think it's and I'm also challenging the children, that before you leave, you must donate to the College of Medicine, University of Ibadan. You are both MBBS class of 2011. You had no loans when you left this place. Your mates in the US have loans. Some of them are paying loans for 20, 30 years. Before you leave, you have to make some donation. We are building a student hostel. The student hostel cost us 3 billion. So far, we have raised 1.2 billion from alumni. Your class has not spoken. No amount is too small. Do you know, we had to move from Paul Hendricks to this place, and I apologize for that. That is because the Ibadan Medical Specialist Group have just given us 34 million to renovate the Paul Hendricks Lecture Theatre. Oh yes. So before you leave this place, I will ask them, second to the college, please give them pledge forms and collect their email and phone number. Please, pledge form. Those, you know, but I'm going to showcase you now. Just in summary, Dr. Dami Welchi, is that when rich, right? Okay. MBBS, you hold a MBA specialization in healthcare administration, a Master of Healthcare Leadership, certified professional in healthcare quality. Currently, you serve as a system director of quality management and patient safety officer at Olaf Health System. It's a prestigious institution affiliated with the University of Kansas Health System, consistently ranked among the top 50 hospitals in the USA. You may, yeah. You're going to rise and rise. You may not be able to give me $1 million US like my classmate Philip Oswa, but one day you will. But today you can start, yeah. Dr. Ayotunde Ajaiyeoba completed MBBS also here, furthered education by obtaining MBA, both of you MBAs, healthcare administration from Wichita State University. You're an accomplished graduate certificate organizational leadership and coaching from Northwestern Chicago, and you hold the position of medical director and department vice president at Blue Cross and Blue Shield of Kansas City. In 2020, Ayo was honored as 40 under 40 recipient of Kansas City Ingram Magazine and received the Black Achievers Award of Greater Kansas City. When are you going to go and become a psychiatrist? You taught me. I've been waiting. Engineer, you know to Miss Engineer. You know here, everybody has a title. Secretary, engineer, everything. So, don't, you know, Engineer Opeyemi Ajaiyeoba boasts of a Bachelor of Science degree in Aerospace, Aeronautic, and Astronomic Engineering, complemented by a Master of Science degree in Industrial and Systems Engineering. With over 8 years experience, you have consistently demonstrated unwavering dedication and expertise in the field of maintenance and reliability. Nigeria needs you. Oh, Nigeria, don't say her. Nigeria, encourage him. They will come back and, honestly, one of our biggest problems in this country is lack of maintenance. Oh yes, we just build and forget about it, and then you come back in 5 years, you can't believe it. We have a problem, some problems of, yeah. So, who knows? Who knows? You people must be ready to serve your nation, yes. He served as Senior Reliability Engineer at Viola Environmental Solutions, where he continues to excel in delivering high-level solutions and insights within the realm of reliability engineering. We celebrate you. And then the baby, right? Ayotunde Ajaiyeoba, she also has a Bachelor of Business Administration in Accounting and subsequently earned Masters of Business Administration with concentration in finance, both from Wichita State University in Kansas. She holds a license as a certified public accountant and currently holds the position of Senior Corporate Advisor in Cummins, USA. Her expertise lies in corporate financial reporting, supply chain management controls, and she's an invaluable asset. You know, these are the people that Nigeria has kind of driven away. Oh yes. They are all over the world serving and doing great things. You know what the US does? They go around the world and they pick the best. But we do the opposite. We throw ours out. But a time is coming when you should be on standby as the Ezras and Nehemiahs to return to build the broken gates of this nation. Yeah. And so I say, as I celebrate you and your children, your wife, blessed are those who fear the Lord, who find great delight in his commands. He says, their children will be mighty in the land. The generation of the upright will be blessed before your eyes. And so we celebrate your outstanding contributions to the growth and development of our institutions, particularly in leadership, which can be very difficult. And we pray for health, for strength, for peace, unending joy in this new season of life. Certainly there'll be ups and downs, but that joy, that peace that passes all human understanding to guard your heart. And we join, as you start this new season of life, we join you and your family to say, riches and honor come from you, and thou reignest over all. And in thy hand is the power and might, and in thy hand it is to make great and to give strength to all. Now therefore, O God, we thank you and praise thy glorious name. Amen. Sir, do you want to invite members of the executive of the College of Medicine? I beg your pardon? Yes. Members of the executive committee of the College of Medicine, please, if you are here, those representatives. Professor Charles Bekibeli is acting dean of clinical sciences today. He's also a great ophthalmologist. Oh, he's also fearless. He's the space audit committee chairperson, and he said the truth. And we would finish the work before we leave office. Amen. You can stay on the other side of here. Yes. Please, let's block the, yes. Hearty congratulations, Professor Ayotunde Ajaiyeoba, on your 70th birthday and formal retirement from the service of the College of Medicine, University of Ibadan. We are profoundly grateful to you and wish you abundant happiness in this new season of life. On behalf of the entire College of Medicine community, we appreciate you, sir. Thank you so much.
Jesus, maker of the Lord, Jesus.
Then I was looking around to see if I could get a legend. I'm going to ask our newest Eaglet legend, Professor Arowo Jolu, to come on stage. To come and we have a living legends a group. All are retired living legends, and we're going to be having another meeting in November. We're hoping very soon to have an office, a few rooms for our living legends where they can come, meet together, continue with their work, supervision, because we know that experience that matures is the best of all. So I'm going to ask him to robe you with this living legends.
Tunde, my friend, my classmate, we've been together for a very long time. I'll beat you into the living legend. I pray that you continue to soar and go higher and higher in Jesus' name.
Amen. Amen.
Jesus, maker
That's the MBBS class of 78. MBBS class of 1978. The other people in fact, when you were dean, sir, Professor Adewale was vice chancellor and Professor Akiyinka was provost. So you had it easy. They were in all the levels of governance in the college. We celebrate you. Please, can you join, stay in the center, and let's take a, please.
And everything is you, precious Jesus, a wonderful wonder you are.
Thank you very much. That ends my very short speech.
That was delivered in 1 minute 45 seconds. Don't ask me whether it's GMT or GMT plus 1. Ladies and gentlemen, welcome with me the Chief Medical Director of the University College Hospital, ably represented by the CMAC, Dr. Ayotunde Ajaiyeoba, as he gives his Goodwill message. A round of applause for him.
After the very short message from the provost, there will not be need for another long sermon. The chairman of the occasion, our great mom, Professor Olorin, the VC, ably represented by my own mom. You're welcome. The provost. Provost, no, you didn't lean on your assistant protocol. The past visits here, past provosts, deans, my great teachers, mentors here present. Sir, I want to tell you, it's not about what we say here in your presence that really matters. It is what is recorded on your behalf by God and what we say when you are not there. Daddy will celebrate you. You have been so nice. You have been so good in every ramification. In teaching, you are good. In clinical services, you are very good. So I'm here to represent my beloved CMD, Professor J.C. Abiodun Otegbayo, to congratulate you on this occasion. We will have loved to be here, but he has another meeting in town. That's why he's not here. So we'll congratulate you. I will just share two experiences, and you know you can go without one, sir. Patient testifies about your goodness, the way you handle them. In fact, I was telling the HOD, the way you even dress to the clinic, very neat. The way you handle the thing, the perfume and the scent that will come. When you are doing the fundoscopy, the patient will want to grab and say, don't go. The other experience when you were dean, I was still hospital consultant. And I was in your office, you just said, Abro, when are you presenting, coming up with your papers for your promotion? And within me, I was like, I'm here to even join college. But that's your question that day made my mind formed. Even if my salary will drop, I will go into that academics. And that is why I am here today, to the glory of God Almighty. And when that turbulent interview was being handled, you were the dean then. Provost was just coming in and going out, and you are there. But we thank God, today all is now a history. We can never forget you. We celebrate you, and you continually celebrate you. Thank you very much for what you are. So I'm here with my Director of Administration, Mr. Ladejo, and to say that on behalf of the Board of Management, management staff, students, patients of University College Hospital, we congratulate you. We wish you well. You will live long and live well to reap the fruits of your labor. Congratulations. Thank you very much.
Thank you very much, sir. A round of applause for him once again. Yes. So, very quickly, let me call on Dr. BGK Ajayi as he gives his Goodwill message. A round of applause for him. I won't be able to time you, sir, even though they said it's 2 minutes, but I won't be able to give the time, sir.
Well, I was caught unawares. Sunday is my aburo, and he calls me Egmo. We've come a long way, and he's been a great friend of mine. I recently sent a tribute to him on the occasion of my 75th birthday. And that says it all. Congratulations today. God bless you, in your family, and everybody around you.
Thank you very much, sir. You made my job very easy, sir. Despite not giving you instructions. Ladies and gentlemen, permit me to call on our Father to give his goodwill message. Mo fi tọ̀wọ̀tọ̀wọ̀ pé olóyè wa Chief Táyé Ayọ̀rìndé Baálé Kótẹ̀dú. A round of applause for him. Era sir. Kẹpẹ́ o.
Holding the microphone. I don't know what to say, but I can see smiles from the high table. I know why they are smiling. Auntie Miwambio. Auntie, how are you? Agbanyi Adale, Shami. Anytime I see you, I see the glory of God. And anytime, please sit down, don't stand up. And anytime there is an occasion like this and I attend, and I hear what they say about you, and I say to myself, God Almighty, give me the same glory for me to be so honored. I use this opportunity to respect all the people at the high table. The provost is, I don't know why she's in medicine. She should be a broadcaster. But not only that, maybe she's you are correct, but nonetheless, she's been standing on pulpits in churches. Please give her a big round of applause. There is nobody here that is unknown to me, with the exception of the guest speaker today. My dear, keep on smiling. Keep on smiling. May God bless you. And Dr. Adewi, he used to treat my mother, you know, of blessed memory. My mother is gone. Not because you treated her. When I was listening to Professor Ajaiyeoba's history, that he happens to be the only boy, I said to myself, why do you have to copy me? My mom used to be called Yabeji. I haven't given birth to twins 3 times. No, just wait. But I happen to be the only boy amongst the... Professor Bekbeli, where are you going? Don't go out before I finish. I tell you something. I happen to be the only boy amongst these sets of twins, and I was born blind. Don't say ha. That is one of the major reasons that I'm here. That's one of the major reasons that when Professor Ilesomi and Topelonge, I don't know if they are here. Where are they? They're both here. Please remain standing. the name of God, give them a big round of applause. Thank you. I wouldn't have known anything about ophthalmologists. I wouldn't have been involved. They led me to be involved when they were celebrating 50 years of UCH. And I said to myself, what's my business in UCH? They said they wanted somebody from outside to represent the general public. And they chose me. They didn't know what type of a person I was. Please sit down. And I had to put in my best in being very investigative and giving the people in my team, my committee, sleepless nights. And by the grace of God, we came first. I got interested in ophthalmologists. Auntie Agbanya Dale, knowing you and your background is to remember my parents and your parents. Very, very dedicated in training people, but being disciplinarian. You get the training. Professor Lesami and Professor Alonge, I thank God for your life, that I'm involved in this particular department. But why am I here? I'm here because, one, Professor Ajaiyeoba happens to be the son of the Shori. I'm here because I happen to be the chairman of all traditional ballets in Ibadan land. No. I'm here because I'm the ballet of Ikotedo. I'm here because I'm the chairman of Yoruba World Assembly. And here is a Yoruba man getting on. Oh, please give him a big round of applause. It's not finished though. Professor Ajaiyeoba and I attended the same school. Professor Ajaiyeoba is replicating my old late friend, Professor Akikugbe. When you look at him, you won't see any, it doesn't show that he's anybody. But the grace of God in his life shows from his attitude and performances. Give him a big round of applause, Joe. And Timmy, you keep on smiling. Professor Ajaiyeoba at school was brilliant. Musini Eshao. Today's event has given me the chance to air my view about both UCH and UI. You have not exploited the provost. I'm addressing you. And Dr. Adeoye, transmit this to the CMD. You have not exploited outside influences to bring you funds into UCH. There are multi-billionaires out there, even in Ibadan here. All you need to do is call them and say, we want to honor you with a theater. I'm not joking. We want to honor you with a theater. Take care of the place. You have not done that. You have not gone to the extent of exploiting our national, no, I don't want to talk about National Assembly because I have grouse against them. Anything national, they first of all think of the North. North in Boni. I'm sorry, I don't want to talk politics here. I saw a lot of politics from your deliverance. And I said to myself, what about Southwest? What about South-South? We've expended a lot of our earnings in Nigeria on the North. Enough is enough. Let there be equitable distribution of wealth. Yes or no? Yes. Give that a round of applause, Joe. Now, from the time I started, through Professor Ilesomi and Professor Tokwe Lunge, that hard-working, bald-headed man. Let me tell you something. They have never denied me of my requirements. But all of a sudden, many things started dropping in UCH, and I said to myself, is this the UCH that I got interested in? Is it the same UCH that has no doctor to come and fulfill the eye outreach anymore? By the grace of God, I think I've handled in my house over 60,000 patients for free outreach by UCH in collaboration with the Kotedo people. But we can't do that anymore. Everything has dwindled. Is it because of Naira falling, or is it because of bad management anywhere? Excuse me, there's something they call JAPA. Is there anything called JAPA in UCH? I hear yes and no. The no's have it. Professor Ajaiyeoba, we are here to celebrate you, because without you, I won't be here. I said I'm here because, number one, you are the son of the son, which I am with you. Number two, we attended the same school, Ibadan Grammar School, the foremost school in Southwest. Up school, thank you. And number three, because you are a lone ranger amongst your siblings, which I am. I told you people I was born blind. Really blind. And I got my eyes restored. UCH wouldn't want to hear that. Not by, my mom refused, you are shaking your head. My mom refused bringing me to Adeoyo. We had Adeoyo then. Said no, the eyes will open. Provost, I don't know. That's why I say I see something about you. This religious aspect of you. Thank you, keep it up. My mom said no. Then all of a sudden, when elderly people are playing Ayo, they normally have palm wine. And with my eyes still closed, I was still moving. I was still running. I had inner eyes. And they couldn't believe what was happening. And I could predict what will happen. With my eyes closed. When people had 32 teeth, I had 36. Yes. And then they said, as my uncle was playing Ayu, we were running around, I knocked the god of Ayu. Palm wine came out of it. And Jongba Ayu, she looked at me, bah! My uncle said, Korina. No, what do you mean by Korina? He cannot see. He said, in 3 days' time, I will be here, and you will see. There was that man in the Bible who said, thou son of David, have mercy on me. And what happened? People wanted to stop him. And his eyes opened. There was another instance where a blind man, not blind, he didn't have eyes. And they called Jesus.
And Jesus saw it. Went, bent down, got sand, spit on it, and put it on the eyes. And what happened? I can't hear you. Let anybody tell me that it is only when you have operation that something can happen to you. No. The man came and put all sorts of things that twins eat on my head. And believe you me, my eyes opened. Professor Ajaiyeoba, you have done a lot today. Auntie, I know you. I think you still have about 50 more years to live. Don't argue with me. 50 is not too much. You don't want to be carried around, Abby. Oh, okay. Ask for whatever you want. You are granted. Distinguished ladies and gentlemen, I am here to say that you are blessed, Professor Ajaiyeoba. I can say it now as my closing remark. Eternal King of Glory, please stand up. We give you the best of the rest of all your requests in life. And that goes for anybody who says amen here. Oh, come on, say amen properly. If you then mean it, clap for him as he's standing. Well. The eye outreach is in comatose now, and I'm not happy. I like to get in touch, make sure eye outreach every day. Now, if you have to teach provost and my dear, if you have to teach people emergency of how to be doing that eye outreach, and you say, and tell your CMD too, it has to be revived, not to die. Most of them, I speak to them, those that have gone to Japa, I know them, and I speak to them regularly. I say, when are you coming home? The eye outreach of UCH is dead. Will it be resuscitated? Will it be resuscitated? You are saying yes. May God bless you.
A big round of applause for him. Abanita Lorila, you may please be seated. Abanita Lorila, amen. Permit me to quickly call on the last two people that will be giving their Goodwill messages. Our time is fast spent, so I have to apply the timing now. And I've been reliably informed by Lesa that the outreach is still alive, just that it will get to you, sir. It will get to the locations too. There are so many locations. Ladies and gentlemen, welcome with me to the microphone as he gives his good message on behalf of the 1978 class of MBBS Ibadan, a former Chief Medical Director of the University College Hospital Ibadan, Professor Abiodun Ilesami. A round of applause for him. You're welcome, sir.
Thank you very much. I know the time is well spent, so I have to lie down the existing protocols. But in spite of that, let me acknowledge our great Mama, Mama Ekabokma, Eshegon Ekpefunwa, and of course, my teacher in the house, Dr. BJK Ajayi, and my distinguished sister, and my primary employer, so that you don't stop my salary. All right. Though you know your husband is very close to me, he will just fill in the gap. Tunde, I'm very happy for you. Today's your day. It's a day that the God has chosen. and it is marvelous in our eyes. You will celebrate many, many more years in Jesus' name. You'll be so wonderful because you remember my first interaction with you, which will be almost 30-something years ago, when I had a patient, an elderly person, who was just a family friend, and I had to come to your house. And you said, "Ìwọ boy, kí ló ń ṣe now, don't worry. Jẹ́ kó wá bá mi clinic, mú wá bá mi clinic." Bring him to the clinic the following week, and everything was sorted. And of course, you know, since that time, we've glued with each other, together with our common friend, Rọ́pò Òjó, tó ti jápa tipẹ́tipẹ́. And I remember that even as CMD, you are one of the few people who will come to my office anytime you're passing, and we talk. And even when I finished, when I'm in my office, we come. If it's lunchtime, we have lunch together. God will continue to promote you. And we cannot say anything about Tunde Ajaiyeoba without being thankful to Edith. God will continue to strengthen you, Edith. You've been such a wonderful wife to my brother and friend. And Bale Eshekwosao, thank you. And you know you've had, the outreach will soon come to Ikotedu. And of course, since I know your house, I will bring them. Am I worried? So I thank everybody for being here. Thank you so much for this honor to get this. Thank you. God bless you.
Thank you, sir. Okay, so last but not the least, welcome with me Dr. Ayotunde Ajaiyeoba, the National Postgraduate Medical College Chairman of the Faculty of Ophthalmology, as he gives his goodwill message and also presents a gift from the new Ophthalmology Group. A round of applause for him, a round of applause for him. The great-grandmother of our faculty, not just the faculty, but the ophthalmology itself, one of the foundation fellows of our faculty. My good friend and keynote speaker, the principal officers of the university and the hospital, the time is fast spent. I consider myself very lucky to be here this afternoon, not only in my position as one of the mentees of the retiree. The time I came to UCH for my ophthalmology residency, he was already a consultant in 1989. So he's one of the younger consultants who trained me. Move so that we do not miss his contribution to the faculty. Because I must say that all what people have been saying is exactly that. And for you to know that I'm not here only in my personal capacity, but also to represent the faculty, I would like
all the faculty, examiners, and fellows who are here to please stand up for recognition. All faculty of ophthalmology, National Postgraduate Medical College. In fact, there are even past chairmen, past secretaries here, and our foundation fellow in that faculty is Dr. B.G.K. Ajayi, foundation fellow by exams. Thank you very much. You can have your seats. So it is my pleasure to wish one of the fathers of our faculty a successful retirement. As it is obviously seen, he is not tired. I'm sure he's not going to just go and sleep at home. We will still require your knowledge, your advice, and your participation in our faculty activities. As you can see, he's already agreeing with me. So I'm very happy to be here this afternoon. Congratulations, sir. One of the specialties in our faculty, the neuro-ophthalmology subspecialty. Professor Ajaiyeoba volunteered to birth that subspecialty group, even though he is trained in pediatric ophthalmology. So he became a foundation member of neuro-ophthalmology subspecialty group by choice, because there were very few, and he became the father of that subspecialty. So it is my pleasure to present this plaque on behalf of that subspecialty group to you, sir. And this beautiful photograph of Professor Ayotunde Ajaiyeoba and the plaque, congratulations. In recognition of your active participation in the affairs of the OSN Neuro-Ophthalmology Subspecialty Group. From all of us at Neuro-Ophthalmology Subspecialty Group. Congratulations, sir. Okay.
Thank you very much. A round of applause for them. Celebrants, so in closing, we would like the celebrant to respond to a few of the Goodwill messages so that we can close.
The time now is 23 minutes past 2, and the day is fast spent. So I'll try as much as possible to just waste not too much time again. The chairperson, ma'am, I not only beg to stand on existing protocol, I want to kneel on it and I want to lie on it. Today I stand before this august audience in September to exit my stewardship spanning over 43 years. I'm so overwhelmed with joy that even right now as I'm standing in front of you, I'm almost speechless, but I must say something whilst I'm standing here. So I'm speechless, but at the same time, I'm very happy. I'm so overwhelmed with joy. I don't even know what to say again. But first and foremost, I must give glory to the Almighty God that I turned 70 today. And as soon as I walk out of that door and that gate, I become jobless.
Just like yesterday, everything has gone so fast. I remember the first time I walked in the corridors of ophthalmology, a young man just coming from youth service and everything, and I was just marching as if I was the owner of the whole of UCH. But today you can see that I've slowed down. Those of you that know me, I've slowed down, but at the same time I'm grateful to God. To capture most of what I'm going to say, you just join me in just taking the first chorus of this song. I'm sorry, Chief had gone. I have to say it, sing the song in Yoruba, and it's very short. It's ba 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 ba. Ẹ ṣé o Baba, ẹ ṣé o Baba, àwa dúpẹ́ Baba, ba 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 ba. Ẹ ṣé o. Thank you very much. I want to say a big thank you to two great institutions that have given me the opportunity to give the little I've been able to give to the institution. When they were reading my citation and people were coming forward to say my few achievements, I start asking whether I was actually the one they were talking about. But 43 years is quite a long time in the life of a human, and I have all the reasons to give glory to God. These two great institutions, College of Medicine, University of Ibadan, the University College Hospital, those of us that passed through this institution, we are extremely lucky, because nowhere in the world you mention these two institutions. It's a kind of logo. It's a kind of hallmark, and we carry our heads high all over the world. And when they ask you, where are you from? University of Ibadan, College of Medicine, University College Hospital, it's always a thing of pride that follows. Those two names, they open doors. So I thank God for giving me that enabling environment that these two institutions have given me to contribute my own quota. I know there are challenges, Mr. Provost, Madam Provost, and also the CMD. I know there are challenges. A liter of petrol is about 600 naira if you are lucky to get it to buy. That's not the best situation to manage a big institution and a big citadel of learning like the University College Hospital. But somehow, my provost, the first lady provost, and wife of a former provost, they are attaining great heights. And I know what J.C. Otegbayo is doing with the UCH. Despite all challenges, he's still marching on and he's raising the standard. Please, I want to say that you should continue to strive. We shouldn't give up. We shouldn't give up. We must, because unto us have been given a huge legacy. And this should not spoil in our own time. I also want to say a big thank you to almost everybody here. Please permit me, if it was about 10, 20 years ago when I'm giving this kind of speech, I will not only remember everybody's names by heart, I will also remember your first names. And but today, you agree that the neurons have slowed down, and I cannot remember. But be that as it may, there are some people in my journey of life, academic life, that I must mention. If I go out of this door and I don't mention them, I won't be able to sleep, because this is the last opportunity that I have to say thank you to them. Let me start by publicly recognizing the chairperson of today, my professional mother, my mentor, my teacher, the lady who made me an ophthalmologist that I am today. A woman I admire so much that There was a time I was even dreaming that I wish this woman was the one that gave birth to me. The second time after my own mother. Ladies and gentlemen, help me to stand and give a standing ovation to a lady of substance, the doyen of ophthalmology in the whole of Nigeria. And for a long time, the only member of the World Ophthalmological Congress before other people started joining that. Ma, I'm very grateful, ma. May you live long, and may all your own seats also have grace the way you have. Thank you very much, ma. Secondly, I must recognize the provost. You all saw the substance for which the provost is made of. That particular rendition is not ordinary. I mean, it's quite outstanding. Madam Provost, we are not unaware of all the strides you are taking the College of Medicine to. And I pray that God will ensure and empower you that you reach the heights you have set for yourself. Thank you very much. Let me also recognize the CMD in absentia, JC Otegbayo. Every time on the platform of UCH, we see innovations, creativeness, all with very, very meager resources. His skill for management is unparalleled. And I will say that the good Lord will continue to be with him and make him to take wise decisions to make you still take it to higher and higher. To the keynote speaker, Professor Ernest Omotti, he's given a little speech about how he came to me. Some times ago, I was the examiner, I was everything. But now, I'm working under him in Abuja as the chairman. And he's single-handedly invited me to a meeting. He called me. If indeed it is true that by their seeds we shall know them, then you know that today I'm an accomplished person. To my dean, not present here, but ably represented by my colleague, Professor Charles Bekibeli, represented the dean. The dean sent me a message this morning to say he was away and somebody will be. I didn't even know it was going to be my very own Charles Bekibeli. Thank you very much. To all other deans here present, I've seen deans from the college. I really appreciate your coming. To my immediate boss in my department, Professor Jeff Oluleye, is now my HOD. When Jeff came into the department and assisted me in a retinal detachment operation, he told me a couple of weeks ago that the operation was for about 6 hours or 5 hours. And that was the day he had the inclination, the motivation to become a retinal detachment surgeon. And he says, if somebody can do this, I'm sure I can do better. I'm happy to announce to you that in the whole country, Nigeria, we have Oluleye is the best retinal surgeon. I'm so proud. Ladies and gentlemen, I owe the success of the little I've been able to achieve because I worked in a very, very friendly department. In that department, we have two mothers, Iya Pupa and Iya Dudu. Iya Pupa is here today, the chairperson, Professor Olurin. Iya Dudu, Professor Laboku Osuntokun is not here, but I'm sure she'll be happy for what has happened in this room today. Apart from two mothers, I have a brother, senior brother, and my senior brother had already spoken. He's somebody I like so much. Everything about Dr. B.G.K. Ajayi is what I've always copied to become what I am today. My two sisters, one of them is here, Professor Aderonke Bayiroju, our own Deputy Vice Chancellor, academic. She's here representing the Vice Chancellor, and I'm so happy that ophthalmologists are taking very, very big positions in the university. My other sister is not here, but I'm sure she would have loved to be here. It's the person of Professor Ayotunde Ajaiyeoba. All of you that know Professor Ajaiyeoba, you know that Professor Ajaiyeoba is, To all consultants, I just say one thing about Dr. B.D.K. Ajayi. We don't have much time. I have a whole thing to say about you, but my brother, you are one of those people I like and admire so much. Thank you for all the things you've imparted on me. I'm very grateful, sir. To all consultants in the Department of Ophthalmology, starting with Professor Bekibeli, Dr. Bade Ogundipe, Professor Yemi Fashina, Olusanya Olawoye, Ayorinde Ogun, Afolayan Babalola, Majekobi Nisarimiye Ugalahi, Anujadiola, then Dr. Logundudu. I say a big thank you to all of you. There are some other residents of mine that have finished from UCH. I can see so many faces. Dr. Shijuwala and Dr. I can't remember what. I'm looking at her and she knows me, Others in the department, Dr. Dongo, the chief optometrist, and my own people, they are sitting on that row. The secretariat, please stand up for recognition. The secretariat staff, these are the people that make my life easy in the department. Oga, what do you want to type? When are you going for your meeting? And they come and ask me around lunch, Oga, you are looking so hungry. What can we get for you? Let's leave it at that. Of course, my business in ophthalmology will not be complete without the nurses, the nursing staff in the eye clinic, West One, and theater. I'm sure some of them, I saw some of them walking in at a time. Special thanks have to go to the class of 78. I cannot forget that class. And people refer to the class of 78 as the mafia. At a particular time, we were known as the mafia. Like the provost rightly alluded, there was a time we were the vice chancellor, without the provost, we were the dean, we were HODs, we were almost everything in the university, in the College of Medicine, University of Ibadan. So I have to pay respect to all of them. You have made my life so easy, and I'm always very proud of you in the university. All of you will recognize and remember our own dear Professor Isaac Folorunsho Adewale, former HOD, former Dean, former Provost, former Vice Chancellor, and former Minister of Health. And you will remember our own very dynamic neurosurgeon and hematologist, Professor and Professor Mrs. Shokumi, Professor Shagwaki Inka, who forced me to become the Dean unwillingly. I saw him in the morning. He came to me and he said he wasn't going to become the Provost if I was not ready to be his Dean. And I had to suffer in quotes for 4 years because at meetings, when I look at him for help to help me, he say, no, Dean, you're on your own, just say what you want to say. The rest are Professor Kishomi, Professor Gugefalade, Professor Ayaro Jodu, who is now my senior by 1 month. Professor Debola Roberts, Oluwalabi Ajayi, if they're here. And to all my friends, I've been around for some time, and I have a lot of friends. Professor Lesami just stepped out. Professor Solo Kadiri, I don't know if he's around. Professor Irabo, Shola Oguniyi should be staying somewhere at the back. I don't know whether he's gone. Professor Toka Lunge, Professor Ogbole, and so many people. I just have to also thank my friends in the university, the former Vice Chancellor, the immediate past Vice Chancellor, Professor Eduwo Olanyinka, Dr. Gani Adeniran, Professor Labopupuola. There are other people from the university that are here that I am not able to mention. To my fellow ophthalmologists, my colleagues ophthalmologists from Shagamu, from Lagos, from Ife, I have to mention you because I won't feel too good if I don't. Professor Nobolu from Olabisi Onabanjo University, Professor Jibode, who just made a presentation, Professor Nike Adore, I know you are my senior by 1 year also. Now I've joined the group of retirees. Thank you for coming to witness it. And my very dear sister, a very, very eloquent personality, very enigmatic. She's put the map of ophthalmology not only in Nigeria, she's put Nigeria in the map of the whole world, not only in Nigeria but throughout the whole world. Congratulations on your recent achievements in the World Ophthalmological Congress. We are very proud of you. That's our Dr. Professor Duke Kukuola from University of Ilorin. I must also say thank you to my apostolic parents, Pastor Dr. and Pastor Professor Mrs. Olawaye of the Faith Bible Church. They are the founder of the Faith Bible Church. Pastor and Pastor Mrs. Adeyemi, Venerable and Mrs. Oluwaju. I saw from the Anglican, please stand up, sir, from the Anglican Communion and every member of the Faith Bible Church. My friends from outside the hospital, Mr. Dotun Omokemi and your brother, Mr. Jide Omokemi. I was the eye doctor to their mother for over 20-something years. And Mama said, Prof, the day you are giving your inaugural or valedictory, I will be present. Unfortunately, God I thank the two of them are here. I'm so many. Ladies and gentlemen, I didn't get to where I am today without having some tragic moments. Last year, I lost a bosom friend. Many people who know me will probably know that friend. His name is Mr. Olajide Lanleyin. We were so close that we became more or less like brothers. Unfortunately, death would not allow us to be together today. If he was here today, you people will notice him because he's a very ebullient person. He would be running around. So ladies and gentlemen, even though he's not here, his cousins, Chief Koli Lanleyin and Senator of the Federal Republic of Nigeria, Femi Lanleyin, if they are not here today, I'm sure they'll be here some other time. My cousins that have just left now, Mr. and Mrs. Kalebe and their family, their daughter is here and their children are here. Please stand up for recognition. Thank you for coming all the way from Lagos. Captain Abidori and Mrs. Abidori also. Ladies and gentlemen, in ending this my long epistle, and you will forgive me, I know I have not mentioned everybody I'm supposed to mention, but before I sit down, let me recognize my siblings. In my family, my mother was a very sentimental person. If Mama was here today, you'd be crying from joy. But my big sister is here, who remains as mother to all of us, Sister Taiwo Ogudairo. My bosom sister, we had very good childhood, and I cannot imagine a better sister to have at that point in time of my life. She came all the way from the United Kingdom. She's also one of the Japa syndromes, the very first generation of Japa, when the nurses were going to Saudi, and she's here today to honor me. Mrs. Feyi Olale, please stand up for recognition. She finished her nursing career from UCA before she decided to Japa. So you owe, does she have to pay something to the college or the School of Nursing? Okay. And the baby of her family, her husband, Jide, and Toyin Oladoye, all the way from Osogbo. They are the one in charge of the Redeemed Church in Osogbo, one of the biggest parish in Osogbo. I'm happy that you are here today. Well, I'm trying to see those that will sanction me if I have to go. But before the final, the man Ayotunde Ajaiyeoba will not be here today. All the energy you see me dissipate on the corridors of UCH and on the corridors of the eye clinic, in theater when I've just finished an operation. You know how those I say I've done it again. All those energy, all those confidence, all those trying to look as a superstar. The Americans say to be the bomb. It's been possible because of my amiable wife, Professor Edith Ajaiyeoba, me Osuntokun. Of course, the story of my life will not be complete without my children. Only Atinuke, who is unable to come all the way from the US, is absent. My first daughter, who looks exactly like me, but only for the fact that she's the female, she's there. We call her the Iron Lady in our family. Dr. Damilola Weinrich, I'm so proud of you. Of course, my son, Junior Stand-Up. People say we look alike, and even his voice, when he speaks, is almost the same as my voice. And he's so fond of me. He sees me as, I don't know, but he said a lot of good things about me. Thank you very much for being here. My second son, exact opposite of Professor Ajaiyeoba, Okoyomi. The exact opposite. And whilst I'm the outgoing, always, when I'm talking, I talk passionately, and even when I'm making a point, the person who is arguing with down, Opeyemi will not even say anything. When we are having quarrels, because the rest of us are very strong personalities, when we are having issues in the family, you can imagine the wife was going to come, but he couldn't come. So thank you for giving us a very beautiful daughter. Ladies and gentlemen, thank you for having the patience, to listen to everything I've been saying. There are so many things I want to have said, but the day is fast spent. I thank you for being here with me, and I thank you for listening. Thank you very much, and God bless.
Shall we give a standing ovation, please? A big round of applause for him. A very big round of applause for him. Thank you. You may please be seated. Like I said, he was writing right from the beginning, and I can tell you that he didn't read half of what. You may please be seated, sirs and masters. He didn't read half of what he had written down to read, and that was because of our time. And on behalf of the celebrant and the organizers of this occasion, Permit me to once again. Hello, please sit down.